Hello everyone, am I live? Am I clearly visible, audible? Can you write down something in the chat box if I'm clearly visible and audible? Hello? Someone respond please. If I'm clearly visible and audible. Good afternoon, Karthik. Good afternoon, everyone. So I guess I'm clearly visible and audible. Thank you. Thank you for responding. Thank you so much. So can we continue in the second half? Huh? We have already started demography. We have already completed demography. We have started the family planning. So we were looking at this thing. We were looking at the various methods of the contraception. So we have covered main methods. The last method, the hormonal one, is pending. So let's go with the hormonal one, finish the hormonal one, then this will be completed and we will be starting the small chapters after that. So without wasting any further time, let me start the hormonal contraceptives. I mean the OCPs, oral contraceptive pills. So they are the most important, very commonly used contraceptive. What is the mechanism of action? How does they act? You know, in the brain there is pituitary. Just below the pituitary there is there is hypothalamus. Below the hypothalamus there is pituitary, and these are the gonads. These are the ovaries in the body of a female. So you may be knowing from the hypothalamus, GnRH is secreted. Gonadotropin releasing hormone is secreted. When GnRH stimulate the pituitary secrete FSH and LH. This FSH and LH goes on the ovaries, and ovaries secrete estrogen and progesterone. From the ovary, two things happen. Number one, ovulation takes place from the ovaries, and estrogen and progesterone is secreted from the ovaries. You may be knowing this axis. This axis is known as hypothalamus, pituitary, gonadal axis. These are the gonads. Gonadal axis. I hope you all may be knowing that. So this estrogen and progesterone have negative inhibitory effect on the FSH, LH and GnRH. So you know this axis. This axis works in human body. Right. Now for ovulation, FSH, LH is required. Without FSH, LH, ovulation will not take place. So basically in OCP, we are giving exogenous estrogen and progesterone to the female. So we are giving external estrogen and progesterone to the female. So the concentration of estrogen and progesterone in her blood will be high. So that will give a negative feedback on the pituitary. So FSH and LH will always be low. And that's why ovulation do not take place. This is the mechanism of action. How many of you got it? This is the mechanism of action. So what we are giving in a OCP? In a OCP, we are giving estrogen and progesterone. So estrogen progesterone concentration is high. Oral contraceptive pill, it contains estrogen and progesterone. So in the blood of the female who is taking OCP daily, one tablet daily, the estrogen and progesterone concentration is high. That gives a negative feedback on FSH-LH. So FSH-LH concentration is low. So it will inhibit the ovulation. How many of you got it? Say, respond. So this is the mechanism of action, the main mechanism of action. Okay. The main mechanism of action. Okay. So see, let me draw the reproductive tract in a female. The female reproductive system. You can see I'm drawing the uterus, I'm drawing the fallopian tube, I'm drawing the ovary. This is the vagina. Okay. So what I said, ovulation will not take place. The female who is on OCP, in that female, ovulation will not take place. That is the main mechanism, inhibition of ovulation. Ova will not be released because in the blood, FSH and LH are low. FSH and LH are low because in OCP, estrogen and progesterone are high. So because of high estrogen progesterone, FSH LH is low, so there is no ovulation. Now imagine if by mistake ovulation is occurring. So where does the ova go? Ova will go here. The ova will go in the uterus. Okay. And during that, imagine if sexual intercourse also taking place, so sperms are also coming. So OCP have one more additional mechanism. Apart from inhibition of ovulation, one more mechanism. It thickened the cervical mucus. It caused thickening of the cervical mucus so that sperms cannot penetrate and come inside. So second mechanism is thickening of cervical mucus. By mistake, if sperms are also penetrating after that only, and the ova is also not inhibited and ova is also released. So the third and the last mechanism, fertilization will take place now. Now imagine the fertilization have taken place and the zygote is formed. This is zygote. The third mechanism of the OCP, the zygote, it's formed, but it cannot be implanted. It cannot be implanted in the uterus. The uterus is unfavorable for implantation. So these are the three mechanisms by which OCP act. Tell me the three mechanism. Yes, absolutely right, Elizabeth. Tell me the three mechanism. The first mechanism, it inhibits ovulation. It inhibits ovulation by negative feedback. You all are right. This is the main mechanism. Second mechanism, it thickens cervical mucus so sperms cannot penetrate inside. And number three, it makes the uterus unfavorable for implantation. So at three different levels it is acting. If one mechanism is not working, by other mechanism it will work. The second is not working, the third it will work. That's why OCP have a very high success rate. The failure rate is very less. How many of you got it? Say, respond. So these are the three mechanism of action of the OCP. Number one, estrogen and progesterone are high in the blood. That's why it is causing a negative feedback of FSH and LH. So no ovulation. The main mechanism. Prostaglandin thicken the cervical mucus. So it prevents the entry of sperm, penetration of sperm into the reproductive tract of the female. That is the second mechanism. Third, it will make the endometrium unfavorable after fertilization. So there is no implantation. Although fertilization is there, but implantation will not there. I guess you all got it. So these are the three mechanisms by which OCP causes contraception. There are two types of hormonal contraceptive: oral, injectable. Oral is OCP, oral contraceptive pill. Injectable is injectable contraceptions are there. Oral pills are of three types: monophasic, phagid, and minipil. So what is monophasic pill? So that is the Mala D and Mala N, the most commonly used. The most commonly used pills is Mala D and Mala N. You have to learn the composition of Mala D, Mala N, and the third type is new low dose OCP, that is Familon. So please learn the three types, Mala D, Mala N, and new low dose OCP, that is Familon. So let me tell you the composition. What is D, what is N? Estrogen is present, the same estrogen, ethyl estradiol, ethyl estradiol, ethyl estradiol, the same estrogen present in all. The progesterone is different. You can see in Mala N, N for norgestrol. In Mala D, D for desogestrol. Okay, and in Familon, the progesterone is desogestrol like Mala D only. Okay, so progesterone is always 0.15 milligram. But here it is norgestrol, here it is desogestrol. Norgestrol, desogestrol. Please learn. And the estrogen is always same. It's ethinyl estradiol. It's ethinyl estradiol. Initially, it was 0.03 milligram. Okay, but here we have seen there are many adverse effects of the estrogen. So we reduced it. So it's instead of 0.03, it's 0.02. It is known as new low dose OCP. So tell me the composition. Tell me the composition of Mala D. Tell me the composition of Mala D. Tell me the composition of Mala N. And tell me, first write N and then write D. And tell me the composition of Familon, low dose. So you get questions on that. Tell me which estrogen, which progesterone, and how much. Estrogen is same in all of them. Ethinyl estradiol. And now progesterone is different. N for norgestrol. D for desogestrol. Familon also have desogestrol. Now tell me how much. So progesterone is always 0.15 milligram. Estrogen 0.03 milligram. But we have reduced it to 0.02. I tried my best to explain you. How many of you got it? You have to learn the composition of Mala D, Mala N, and Familon. Please learn that. Please learn. Howsoever you learn that. What is the schedule total? Total, how many pills are there? Total 21 pills are there. That has to be started on day 5 of menstruation. Day 5. Day 5 onwards start. So on day 5, take first pill. Take first pill. Take the first pill on day 5 and continue it for the next 21 days. So 21 plus 5, it will be day 26. Almost day 26 you will complete the course. The female will complete the course. Day 26 onwards, leave it for 1 week. Within that week, again bleeding will occur. And again on day 5 of the bleeding, it should be started. So the cycle should be continued. It should be started on day 5 for the next 21 days. This is the scheduling. I guess everyone knows that. Now coming on the adverse effects of OCP. We have already seen the adverse effects of IUCD. The most common adverse effect of IUCD is bleeding. The second most common is pain, but pain is most common cause of removal. I told you for IUCD. For OCP, most common side effects are cardiovascular due to the estrogen. Estrogen causes cardiovascular effect. That's why we have reduced it later on. In Familon, we have reduced the estrogen. हमने reduce किया. It causes MI. It causes cerebral stroke. It causes thrombus formation, hypertension. So ये सारे effects अच्छे नहीं हैं estrogen के. That's why we have reduced it. It is carcinogenic also. The OCP used for long time, for 10 years, 20 years, continuously, it can lead to breast cancer and cervix cancer. Okay, and metabolic effect are due to progesterone. It causes rise in blood pressure, altered lipid profile, and hyperglycemia. More glucose, more lipid, and more blood pressure. These are the effects caused by progesterone. Others you don't learn, have a look. That's it. Don't learn. Okay, these are the side effects of OCP. But there are beneficial effects also. है ना. Beneficial effects में these are the cancers which reduce risk. The risk is reduced due to OCP. है ना. I told you cervix and breast cancer occurs due to OCP. है ना. It increases the risk of 2 cancer, but it reduces the risk of 4 cancer. Which 4? Benign ovarian disease, malignant ovarian disease, endometrial cancer, and colon cancer. These are the cancers for which it is reducing the risk. It is increasing the risk for cervix and breast. लेकिन ovary और uterus और colon cancer की risk को कम कर रहा है. Got it? Learn absolute contraindication. Don't learn relative. Just a second. Learn the absolute contraindication. Absolute contraindication. Don't learn the relative. There also I told you absolute contraindication, if you remember. I told you absolute contraindication IUCD may be the female who is pregnant, don't insert IUCD. The female who is having PID, the female who is having cancer. Here also the female who already have breast cancer. You cannot give OCP to such female because OCP further increases the risk of breast cancer. A female who is having genital cancer, any of the genital cancer. A female who is having liver disease. The female already having thromboembolism. The female who is having cardiac problem, because OCP also increases the risk of MI. The female who is having hyperlipidemia, because OCP further increases the lipid. Undiagnosed bleeding and pregnancy. So these are the absolute contraindication. You will not give OCP to such female. So before prescribing OCP, you should ask all these things. Okay, so we are done with oral contraceptive. There is a special type of oral contraceptive. The brand name is known as Saheli. The brand name is known as Saheli. I forgot to put the image. The brand name is known as Saheli. It is known as Sancroman. है ना? It is known as Sancroman. The brand name is Saheli. है ना? What does it contain? It is discovered by CDRI Lucknow. That is Central Drug Research Institute Lucknow. It contains or milozifan. Split it and say it. Or milozifan. It's a chemical formula of Sancroman. It is known as Saheli. The mechanism of action, it acts as a SERM. है ना? It's selective estrogen receptor modulator. Just learn that. It is also used as a contraception. Okay. Apart from the female pills, male pills are also available. है ना? They were tried, but it was a flop idea, so it is discontinued from the market. Instead of female pill, the male pills were there. The male pills, what does they do? The male pill contain gossipol. Gossipol is derived from cottonseed and it kills the sperm. That is the male pill. है ना? It prevents spermatogenesis, I mean. It interferes the sperm storage and maturation. Okay. But it was found that it permanently causes azoospermia and it can be toxic. That's why it is withdrawn from the market. Got it? These are the oral contraceptive. Are you people still there? Let me tell you the injectable contraceptive. There are 3 injectable hormonal contraceptives: DMPA, NETN, and DMPA subcutaneous. Don't learn, just have a look. Nobody is going to ask you questions from that. DMPA is depot medroxyprogesterone acetate. So these are the injectable one, and once every 3 month injection has to be given. That's it. Newer contraceptive, no need to go. That's it, I guess. I guess we are done with the contraception. Okay. Are you people still there? Can we continue? Can we continue ahead? So that's it. Hana. So that's all about the contraception and demography we have completed. Let me start the next chapter. Please start the 7 small chapters. I have already provided the PPT. Now these are the small chapters, but very scoring. You usually get questions from them. Just a second. Let me start. Can you see it? Let me see. I guess you can see it. So these are the 7 chapters I am going to take one by one. I will start with disaster management, followed by biochemical waste management, then occupational hazard, then genetics, then mental health, then social science, and finally the history, primitive and modern medicine. So these are very small chapters. So one by one, we are going to cover them. So give me a minute. Let's start them. Let's start one by one. Okay. So let's start with the first chapter, disaster management. What is disaster? Does anyone know? Sriniket, Prabhangal, Javed, Karthik, Amu, Elizabeth, anyone here? Aditi, Megha, Ratnadeep, Shivangi, anyone? Do you know what is a disaster? Can you define disaster? Hindi mein kya to pralay aa gaya. Disaster. It is any occurrence in which more than 30 people are injured or dead at one time simultaneously. So the cutoff is the 30. So more than 30 people, just suppose a bus accident, a train accident. Let me show you a few disasters. These all are disasters. You can see a train derailment. You can see a volcano eruption, an earthquake. An earthquake is there, volcano eruption is there. These all are disasters. So more than 30 people are injured at the same time, simultaneously. They are injured. They are dead or injured. So this definition is given by Colin Grant. Please learn the definition of the disaster. What you are saying, Javed, amphibious means? So that is a disaster. Okay, something that caused damage to the not only human life, life and property both. Yes, but the cutoff is the 30. Please learn the cutoff, it's 30. Okay, now there is a disaster management cycle. What are the steps in the disaster? So first thing, when the disaster occurred, there is an impact of disaster. Let me explain the impact. After that, there is response, then there is rehabilitation, then there is reconstruction, then there is mitigation. Mitigation means for the next time we are prepared. Preparedness and mitigation is same. That for the next time we are doing the preparation. For example, do you know in Japan earthquakes are very common? How many of you know that? I don't know. So Japan mein earthquakes are very common. So in Japan the buildings are made such that the base is like that. Even on earthquake it do not collapse. So that is preparedness for the next time. That is mitigation. Hana, mitigation is the preparedness for the next time. So these are the steps. These are the steps in disaster cycle. See, it's very interesting. Small chapters and very interesting chapters. Let me start with the disaster impact. One by one, you have to learn the cycle. So let's start with the impact. After impact, I will explain you response. After that, I will tell you recovery. Rehabilitation, reconstruction is recovery. And finally, mitigation. Mitigation and preparedness. So one by one, we will see them. Let's start with impact. Disaster impact. In the impact, there are 5 things. As soon as any disaster is there, you have to do search, rescue, first aid, then field care, then triage, then tagging, then identification of the dead. In this sequence, the sequence has to be followed. Listen, the first thing is the search, rescue, and first aid. Who gives the search, rescue, and first aid? So the uninjured survivor. Imagine there is a train accident. So many people are injured, but many are uninjured also. The uninjured survivor will give the first aid and do the rescue of the injured one. So the first thing, to save as many as life, do rescue as many as you can and provide first aid care to them and search them. If they are here, there, search people as much as you can. This help is provided by uninjured survivor and nearby villages, other people. That is the thing. After that, the second is the field care. Now, in the field care, you do the bed availability. You will make the tents there only for the stay of the people. You will give the bed availability. You will make doctor staff available there. Surgical services will be available there. Food should be available. Shelter should be available. And you have to inform the patient's relative, patient's friend. Victim identification. And you have to make a big space of mortuary. Big space, arrange a big space of mortuary depending how big is the disaster, how many deaths you are expecting now. So based on that, make a space for the mortuary. You cannot leave the dead bodies here only. You will say, ma'am, why? Let the dead bodies here only. Let's save the uninjured. Let's save the injured people. So dead is already dead. Now why we are bothering about them? Let's save the injured one, shift them to the hospital and treat them, provide the surgery or all the medical help they require. Why we are worried about the dead? Because if we leave the dead bodies here only on the field itself, so they will contaminate the water. And here only we are making the tents and stay shelter around only this disaster now. So wherever the disaster is taking place, suppose this is a disaster, so we will provide the stay around it only. We will see the stay around it only. So bed availability, food, shelter is around that only. So if the dead bodies are left there only, they will contaminate the water, and all the people who are injured and uninjured survivor, they will have gastroenteritis. So see this line. Most common disease post-disaster is gastroenteritis. Gastroenteritis is due to contamination of the water by dead bodies. So that's why removal of the dead bodies from the field is very important. How many of you got it? How many of you got it? So most important strategy post-disaster is to provide a safe drinking water to the survivors. Okay, you have to chlorinate the water. You want to supply safe drinking water to the survivors in the shelter, in the tents, in the camp. You have to do the chlorination. Normally chlorination may residual chlorine should be 0.5 ppm. I will teach you this in environment. So it's normally 0.5 ppm, but here it is 0.7 ppm. We keep it 0.7 ppm. Got it? So that is the field care we are doing. That is the field care. After that, we will do the triage. What is triage? Where it is done? Imagine all this is the field, है ना? There is a bus accident, rail accident, volcano, earthquake, anything. So here it's near my hospital, है ना? So I got a call in 2 a.m. at the night. है ना? Just suppose you are a doctor and you got a call at 2 a.m. at the night by the CEO of your hospital, है ना? CMO of your hospital, that there is a disaster nearby, there is a train accident, bus accident, or there is something, and all the injured people are shifting in our hospital, so move immediately to the hospital. So it's an emergency condition. All the staff should reach the hospital as soon as possible, because here with the help of ambulance, the injured bodies are shifted to the hospital. Now in all hospitals, especially in the corridor of the hospital, before taking the injured people inside the hospital, in the corridor only we will do the triage. What is triage? Or here not, we will do the triage at the field only. This is the field. Field is the place where the disaster have occurred. So before shifting the patients to the hospital, we will do the triage at the field. If at field it's not possible, do it at the corridor of the hospital. But before the entering to the hospital, we do the triage. What is triage? Now this is the hospital. In the hospital, we have limited doctor, limited surgical instrument, limited OT, limited medicine, everything is limited. And the number of injured people is out of proportion now. Many people, many patients are there. But we have limited man staff, limited manpower, limited everything. So in the limited resources, we have to save maximum life. That is the funda. During disaster, multiple injured people are shifted to the hospital. Now, any hospital is not prepared for the disaster that one time 1,000 patients will come, 500 people will come, depending on the severity of the disaster. Imagine there is an earthquake. Imagine there is a train accident or anything. So all the injured people are shifted to the nearby hospital. Okay. So after taking the patients into the hospital, there can be a chaos inside the hospital. What to do? Hannah, which patient we have to deal first, which the next. There is a chaos. There will be a real chaos. We do not want to make this chaos. That's why before moving the patient inside the hospital, we are doing triage. What is triage? We divide the patient into 4 categories. There are 4 color coding. The colors are red, yellow, green, and black. So there are bands, like bands are there, not the friendship band or like that. So these bands, let me show you. So the bands are available. So in the wrist of the injured people, we will give 111 color band, whatever the category it belongs to. The patient who require immediate surgery within next 6 hours, and if the surgery is not done within next 6 hours, we will lose the life. So we will give them highest priority, that is red color. है red color band. Either here or these are the cards which will put in the neck. है so that is the red color. Red is the highest priority. The second highest priority is the yellow, in which up to 24 hours also the surgery has to be done. It's okay. They will not die. At least they will survive for the next 24 hours. So after them, the red category, the next category is the yellow. The green are the mobile patient. They have little bit of injuries, just dressing and all is required. They don't require surgery. They are mobile patient. So the least priority. And black are dead. Black are moribund or dead. They are either dead or they are very moribund. You will not be able to save them even on treating. So these are the black one, the dead and the moribund. So give the color coding. This color coding is known as triage. So after doing triage, allow the patients to go inside the hospital. Now there is no queues. You know, all the red people have to be shifted into OT. The yellow one in the ICU, the green one in the wards, and the dead one in the mortuary. So you know which patient has to be shifted there. There will be no chaos. This is known as triage. What it is known as triage and tagging. Do the triage. Who is doing the triage? A doctor will do. Any doctor like you, me, any doctor can do the triage. Where we will do? On the field itself. So on the field, the CMO will send the doctors, go there and do the triage. So the CMO of the hospital will send the triage doctors for doing the triage. So on the field itself, looking at the patient, we will see the respiratory rate, we will see the pulse, and we will see the injury, the severity of the injury, and we will do the triage. So what is triage, you tell me? It is based on the severity of the injury. The highest priority is given to the people who is more injured, and lowest priority is given to the people who are less injured. It is not first come first serve service. है ना? It is not. Otherwise, patient will fight कि पहले मैं आया, पहले मेरा इलाज होगा, तुम बाद में आए. Although the one who is coming later, but more injured, so priority will given to that. So the basis of triage is not first come first serve. No. It's not that. It's based on the severity. The people who are more severe injury will be given high priority. है ना? And the people who are less injured will given low priority. That is the basis of the trial, so that with limited resource, we can save maximum life. And there should be no chaos, no panic at that time. Got my point? How many of you are listening me and getting me? So this is triage. And after triage, we do the tagging. What is red? Red is immediate resuscitation within the next 6 hours. Life-saving surgery is required. What is yellow? Red is the highest priority. Yellow is high priority. It is not next 6 hours. It's next 24 hours bhi chalega. People will not die. The patient will not die in the next 24 hours. So up to next 24 hours, you can attend that. So first attend the red one and then attend the yellow one. The green one are the minor injury. You can take the next category. It is low priority. And no priority, least priority is the black. These are dead and moribund. They are already dead. Now you cannot do anything. Or they are moribund. They are about to die. Even if you treat them, you are not able to save them. Imagine the person is having a skull crack and brain is out. So you are not going to save this person anyhow, although the heart is still beating. So there is no use of wasting the time. Now here time is the key. Each and every second is important. You cannot waste even 1 second. 1 second is equivalent to one life. So it is a panic situation. So all the doctors may be prepared for this. Maybe the God do if the situation doesn't come in anyone's life, but if come, you are prepared for that. How to deal with that situation? Save maximum lives in the limited resource, in the limited time, in the limited manpower. That is the meaning of the triage. So red, yellow, green, and black. You got which one is what. So priority number 1 is red, immediate. 2 is yellow, that is urgent, not immediate but urgent. 3 is delayed, we can delay them. And 4 is dead. Black is dead. Please learn. And after, not only we are doing the triage, after that we are tagging them with the help of the band. We put a band in the wrist or we put a card in the neck. So that is known as tagging, where identification, age, place of origin, triage category. So I will make a card. I will write the name of the patient, age and all. I will see the ID cards, whether if it is the patient is unconscious. I will do all that. And the triage category, whether red, yellow, green, or deceased, like black. So this is the thing. The next step is the identification of the dead. We cannot leave the dead body. Dead bodies is a very delicate social problem. You have to respect the dead bodies also. So identify them and inform the relatives. If the dead bodies are left on the site only, in the field only, they will contaminate the water and all the survivor will have food poisoning, that is gastroenteritis. Gastroenteritis is the most common infection post disaster. So first remove the dead body from the disaster scene. Remove them as soon as possible. Otherwise, once they will contaminate, everything is gone. Okay, so remove them. Shift them to the mortuary. After shifting them to the mortuary, then try to identify them. Don't try to identify on the field only. They can contaminate the water. Remove them as soon as possible. Remove from the field. Shift them to the mortuary, which is far away from the survivors. And identify them and then inform the relatives. Okay, then inform the relatives. This is the thing. So many dead bodies can be there at a point depending the severity of the disaster. And the last rituals of cremation has to be performed at the scene and the mortuary itself, the electronic cremation and all. So, but before that, you have to inform the relatives, and with due permission of the relatives, it is done. The dead bodies is cremated. So that is the care of the dead body. How many of you got it? Yes, Sriniket, these are like traffic light only. The red is the highest category, the yellow is the second one, green is last, and after that we have black also. How many of you got it? How many of people are listening me? That is disaster. So I taught you the impact of disaster. I taught you 5 things in the impact of disaster. First, do rescue. Number 1, do rescue. Number 2, provide the field care. In the field care, arrange as soon as possible doctors on the field. And in the doctors, the surgicals, mainly surgical treatment will be given. So surgical equipment should be available, doctors, surgeons should be available, and food should be available, shelter should be available. So triage, I told you the 4 color coding, tagging, identification of the dead. So these are the steps. In this sequence only you have to follow. There should be no chaos, there should be no panic situation. So you should be prepared for that. Anytime in your life you can face this condition. Depending in which area you are, in which hospital you are working, maybe any tragedy nearby you. And all the injured persons can be shifted in your hospital and you are on duty at that time. Okay, so you have to manage the situation according to that. Okay, that's why this chapter is in your syllabus. Okay, after that, coming on the response. We are done with impact. After impact, we have to look for the response. What is response? Now the complete country will help. Everyone will help. Everyone will send the food, the clothes, the necessities. We will do the transport as much as anyone, the monetary help, any help. So everyone try to help. So relief camps, relief phases there. So camps are, the tents will be there, the relief phases will be there. Help is taken from outside. Food, clothes, shelter, drugs. Everyone will send something. Okay. Now there is a question. Mass immunization should be done or not done in such scenario. Now in a small place, No, there is a small tent in which multiple people are sleeping together there because it is the post-disaster camp. है ना? So what will happen here? Mass immunization should be done or not done? It's an overcrowded area. People can have infection. Huh? Of cholera and typhoid, done or not done? No. Mass immunization is not recommended. No, not at all recommended. है ना? Because it gives false sense of security and it will not any help. So please learn, mass immunization is not recommended in case of disaster in the survivors. No, don't do mass immunization. Only the person who are injured, give tetanus to them if they require that. If they require that, then only give the tetanus. Otherwise, vaccines are not required. Next is recovery. In the recovery, you do the rehabilitation, reconstruction. Whatever is lost, you construct it again. है ना? Food safety, vector control, sanitation, water supply, the buildings are collapsed, you create it again. And finally, the mitigation. For the next time, we are prepared. We are reducing the risk for the next time. That is mitigation. है ना? So we make, like in Japan, I told you, the homes are made like that. Whenever earthquake will come, it will not collapse. So that is mitigation for the next time. So we are done with disaster cycle. How many of you got it? So please learn the steps. है ना? First, there is an impact, followed by response, followed by recovery, that is rehabilitation and reconstruction, and finally risk reduction for the next time, that is mitigation. How many of you got it? Say, respond. So the same cycle is shown to you. Okay, है ना? You know, during disaster, you have to follow certain guidelines. है ना? Do not use telephones unnecessarily. Leave the phone lines free because it can be used by someone else for in case of emergency. So do not keep them blocked. Do not keep them engaged. Except to call for help. Keep them free. बैठ के गप्पे नहीं मारना है फोन लाइन पे कि क्या हुआ, gossip नहीं करना है. Keep them free. Listen to the broadcast on the television, radio, newspaper, whatever they are saying. Listen to the broadcast. They may be giving you some instruction. For example, flood is about to come in a village, so we have to instruct the people living in the village to evacuate the village as soon as possible. There may be a possible threatening emergency, है ना? So follow the instructions what is given on the broadcast, है ना? Carry out all the official instruction. Don't fall in the rumors. There may be many rumors and panic situation at that time, है ना? So follow the official instructions only given on the radio, loudspeaker. Keep family emergency kit ready. At any point, the official announcement should be there. Leave your home as soon as possible and get evacuated from here. So there should be a small kit that you should carry with you, the family emergency. It is not the luggage, the complete home is packed. And be prepared than to get hurt. Okay, wait rather than act too hastily. Don't overreact. Just wait and listen to the calm down and listen to the instructions. Don't be panicked during such situations. Anyways, World Disaster Day is celebrated every year on second Wednesday of October. The second Wednesday of October is designated as World Disaster Reduction Day. And the disaster management, the ministry is the Ministry of Home Affairs. The head of the disaster is Prime Minister of the India. The head of this committee is directly Prime Minister of the. So whatever instructions given by the Prime Minister to the Ministry of Home Affairs, that will be followed. It's an emergency condition. So directly the ministry is the Ministry of Home Affairs and the head of that is Prime Minister. I hope you all got it. You may be knowing major disasters in India. You may be knowing about Bhopal gas tragedy. You may be knowing about Chernobyl nuclear power tragedy. I guess you all know that. If you don't know, you can read the details when it happened. Say something. There is a management, National Institute for Disaster Management. There is an Institute for Disaster Management known as NIDM, National Institute of Disaster Management. The head of which is Union Home Ministry. Okay, Hannah, what is their job? They are like a think tank for the government to provide assistance during the disaster. This is an institute. Okay, that's it. And you have to learn one helpline number, 112. 112 is a toll-free number. It's a helpline number. It's not valid throughout the country yet, but it will be soon. And it's a pan-India single 112 number. It's based emergency response system for the citizens in emergency. So here voice call is available on this number, email is available, and panic button activation. This thing is also available. 112 Pan India mobile app is also available. Hana? So anyone who is in disaster condition, facing any emergency, they can call, send an email, panic button activation calls they can be given, and the team will come to help. This is Pan India 112 Emergency Response Support System, ERSS, in 2019. Hana? So emergency assistance from the police, fire brigade, health, disaster management departments will be given. And currently only in 18 states it's functional in India, not in all states. How many of you got it? We are done with chapter number 1. Out of 7, 1 ho gaya. 6 more to go. All the chapters are very small like this. है ना? ये तो बड़ा था, बाकी सब इससे भी छोटे-छोटे. So you have to understand the concept. These are small chapters. We are done with disaster management. How many of you got it? Can we solve some MCQs? I want you to participate in the MCQ quickly. है ना? The question is in front of you. Read the question, tell me the answer. Arrange the following phases of disaster in logical sequence. I told you the disaster cycle. सबसे पहले क्या होता है? सबसे पहले होता है impact. फिर क्या होता है? Mitigation या response? Tell me the correct sequence. Can you please tell me the sequence? So read the 4 options. I'm not reading it. Yes, absolutely right. Aditi, Ratnadeep, Doxycycline, Shivangi, Leah, you all are right. Here also all the people are right. Yes, Karthik, Sanya, everyone is right. So correct answer is B. First there is impact, followed by response, followed by rehabilitation, and finally it's mitigation. Mitigation is the preparedness for the next time, the last thing. Anna, so B is correct. You have to learn the sequence. Many times you get a question on sequence. The next question, as per most common classification of the triad system, Anna, the color code that indicates the high priority is which color? High priority treatment. Is it black, yellow, red, or blue? In the triad system, which color is high priority? High means highest, I want to ask. The highest priority. Within 6 hours, the surgery has to be done. So it is red. You all are right. The color will be red in that case. You mainly get question on the triage only. Black color in triage indicates what? Dead, transfer, high priority, low priority. The black color. The black color indicates what? Yes, so you all are right. Very good. Very good. Aditi, very good. Yes, Prabhangal, very good. You all are right. It indicates dead. So black color means dead. If I change from black color to green color, will you change your answer? Green color. Green color is low priority. है ना? And if I change red or yellow, it will be of high priority. है ना? In this way, I can change the question. The answer will change. What is triage? Triage का मतलब क्या होता है? What is triage? Can you tell me the meaning of the triage? It's a concept in the trauma. It is a method of breast lump diagnosis. It is an investigation for the duodenum and pancreas, or it is a management of old age health problem. So I guess you all know it's a concept in trauma. During trauma condition, we do the triage when multiple people have the trauma. So correct answer is the concept in trauma during disaster. Hana? So correct answer here is A. It had nothing to do with the breast, duodenum, or old age. No. So correct answer is A, and you all are right. Okay. The next question is in front of you. In disaster management, following are practiced except which is not a part of disaster management. Do we do triage? Yes or no? We do rehabilitation? Yes or no? Mass vaccination? Yes or no? Disaster response? Yes or no? What's the correct answer? Yes, absolutely right. Elizabeth, Karthik, very good. Here also, yes, Aditi, doxycycline, everyone is correct. We don't do mass vaccination because it gives false sense of security. है ना? If we vaccinated all, we will become secure कि चलो अब सब vaccinated है और वो काम नहीं करता है. Mass vaccination is not. Initially, it was recommended, but nowadays we don't recommend it. No, we don't. So correct answer is C, and you all are right. The next question. Match the column. Which of them is correctly matched? One of them is correctly matched. है ना? Red matlab diseased or dead. Is it right or wrong? Black matlab minor injury. Is it right or wrong? Green matlab immediate intervention is needed. Right or wrong? Or yellow means stable patient need observation. Although all are wrong, but fir bhi say the best one. Yes, you all are right. Red is not dead. Black is dead. Black is not minor. They are dead. Green is not immediate. Green. So yellow is stable and need observation. Within the next 24 hours, they require some intervention. So I will go with D. In this way, you get many questions on that. Can I come on chapter number 2? Are you people with me? Be active all the time and keep me active also. If you keep on talking with me now, I will be active. Otherwise, I will be like you only. I will keep on reading without any interest. You don't want me to do this, right? So please be interactive all the time. So I'm very happy that you all are participating in the answers. I'm very happy, very happy. So the next chapter we are taking out of 7, the second one we have started. The second one is biomedical waste management. Let's start biomedical waste management. Okay, first tell me what is biomedical waste? Kaun sa waste? My kitchen waste is biomedical waste? No. I do jhadu at my room. That is the waste, biomedical waste? No. Any waste which is generated during diagnosis, during treatment, during immunization, or during research. That waste is known as biomedical waste that is generated in hospital. So waste generated in the hospital, either during diagnosis of a patient, during treatment of a patient, during immunization of a patient, or during research. Yes, hospital waste is biomedical waste, but define it. So waste which is generated for diagnosis, during treatment, during vaccine, or during research. Such a waste is known as biomedical waste. This is the definition of biomedical waste. है ना? Why it is very dangerous? Biomedical waste is very dangerous. There are many hazards. है ना? Many hazards. You may have hazards from the infectious waste. है ना? Infectious waste से hazard हो सकता है. Sharp waste से hazard हो सकता है. You can get needle prick injury and it can be infectious with any organism and you can have the disease. है ना? Chemical waste can be toxic, corrosive. Pharmaceutical waste can be there causing severe side effect. So this is not important, but you should know. Okay. Now, what is the situation in India? How much biomedical waste is generated daily per day? In India, on an average, 844 tons, 844 ton per day. How this much of biomedical waste is generated every day in India? 844 ton, T-O-N, ton. Tons is generated. Okay, per day. Okay. Out of which only 447 is treated. Maximum it is generated in Karnataka. Karnataka followed by Maharashtra. Listen, now in a hospital waste, please divide it percentage wise. Maximum waste is not biomedical waste. It is simple waste, the general waste. It contains food waste, sweeping yani jhadu ka kachra, or food waste. Maximum 53% is that. This is not biomedical waste. These all will be biomedical waste. This is not biomedical waste. So in a hospital, 15% waste will be paper waste. Nowadays we are trying to move towards paper free. There are many hospitals in India still they are paper free. They don't provide any reports on the paper. Everything is digital. Everything is digital. All the entries are digital. There is no paper. There is no file of the patient. The file of the patient is also digital. So we are trying to make a paper free environment. So but still it's not very common. But in few hospitals in India there is paper free. But paper waste is 15% otherwise. Plastic is 10%. Racks are 15%. So paper is 15%, racks is 15%, plastic is 10%. Metals is just 1%. Okay. Infectious waste is 1.5%. And glass is 4%. Okay. Yes, glass if contaminated, the test tube, the flask, they will be biomedical waste. Test tube is required for diagnosis. So it will be a biomedical waste. So you have to learn the percentage. Say it. There are questions on that. Paper 15%, rag 15%. Then plastic 10%, then infectious waste 1.5%, then metals 1%, or I forgot glass is 4%. Glass is 4%. Apart from that, nearly 50% of the waste is general waste. Please learn the composition. Read the question and tell me the answer. Who will tell me the answer? Can you please tell me the answer? Read the question and tell me the answer, please. What is the correct answer? Hospital waste product accounts for. What is true? Paper 40%, plastic 10%, infectious waste 30%, drag is 30%. Yes, so plastic 10% is true. Paper is not 40, it's 15. Infectious waste is not 30. Infectious waste is 1.5. Rags are not 30, it's 15. But yeah, plastic is 10%, it's correct. So correct answer is B. You get questions on that. Now let me tell you waste management hierarchy. Let me tell you waste management hierarchy. It's known as triple R technique. What is triple R? Try to reduce the waste production. Production ही कम हो, produce. जितना कम produce हो उतना अच्छा है. So try to reduce it. अगर reduce कम नहीं हो रहा, तो try to recycle it. The one which can be recyclable waste, है ना? और वो भी नहीं हो रहा, तो try to recover it. And last में कुछ भी नहीं हो रहा, तो dispose it. So finally dispose it, है ना? So let me tell you biomedical waste management guidelines in India. How many types of biomedical waste management is there? Don't learn the types. I will directly tell you the 4 types of dustbins now. Hannah, don't learn the types, the various types of biomedical waste. Hannah, you just have a look, but don't learn it. Hannah, you can see human anatomical. What is human anatomical? Anything coming out of the body of the human. Hannah, the appendix, the abortion, anything coming out of body of human, any tissue. Hannah, that is anatomical, human anatomical waste. The same can be animal anatomical waste. Anything coming out of the body of the animal. Okay, so this is human anatomical, animal anatomical, soiled waste. What is soiled? Soiled यानी मिट्टी नहीं है. It is not dirty. It is not the soil. Soiled का क्या मतलब है? Any linen or cotton. Linen मतलब कपड़ा, cloth, or cotton which is contaminated with human body fluid. It can be blood contaminated, it can be saliva contaminated, it can be tears contaminated, it can be urine contaminated, it can be ascitic fluid contaminated. कोई भी कपड़ा या कॉटन जिस पे ह्यूमन बॉडी फ्लूइड है, जैसे कि ब्लड कंटेमिनेटेड. इमेजिन आई एम वेयरिंग अ एप्रन or I'm wearing a OT gown or simply I'm wearing a dress, any dress, and I am doing an intervention on my patient. So there is a squeeze of blood and it fall on my clothes. So my OT gown, apron or my dress is contaminated with the blood of the patient. What should I do? I should wash it and reuse it? No, no, no. I should throw it into the incinerator and destroy it. And this is known as soiled waste. This is soiled waste. Got it? All the expired medicine. All the chemical waste. The liquid and the solid. Solid chemical, liquid chemical. All the blood blood bags. So all the blood bags, the chemical waste, linen, microbiology waste, all the culture plates. So these are the types of the waste. Apart from that, there are sharps. Apart from that, the glass. Apart from that, there is metal. So these all are the type of the waste. Don't learn the type. I will tell you in which dustbin we will discard what. We will discard what in which dustbin. I will tell you that. This is the old classification. I'm just showing you for your knowledge. Don't learn it. Please don't learn it. Initially, before 2016, we used to divide the waste into 10 categories. Category 1, 2, 3, 4, 5, 6, 7, 8. But there is a overlapping in the category. And the classification was not good. That's why I'm going to tell you the new guidelines now. But in the old guidelines, we divided the waste into 10 categories. We do not follow it. How many of you got it? Now come on the new guidelines. New guidelines in 2016, they were released. So coming on new BMW guidelines, biomedical waste management guidelines, the new guidelines 2016 onwards. Okay, so here we have 4 color coding, 4 color coded containers. Actually 5 color coded containers. So initially we used to divide the waste into 5 containers, but nowadays we don't divide them in 5 containers. We just divide them in 4 containers. The 4 different color coded containers. Now the black container is not there. We have only 4: yellow, red, blue, and white. The 4 colors of the dustbin. You can see the colors I have mentioned: yellow color, red color, white color, and blue color. These are the 4 colors in the dustbin. The 4. Now you should know in what dustbin what you should discard. Imagine I am giving an injection to my patient. My patient is sick. My patient is having some disease. To treat it, I want to give an injection. What all things I require? The first thing, I will wear the gloves. So I require gloves. The second thing, I will open a syringe, which is made up of plastic. The third thing, I will open a needle, which is a sharp. I will apply the needle on the tip of the syringe. And then I will require a vial, the glass, which is made up of glass vial in which medicine is there. I will break it. And I will take the medicine in the syringe and apply it to the patient. Now I'm having plastic, I'm having sharp, I'm having glass, and I'm having gloves. Where to discard it? All the 4 things will go in 4 different dustbins. It is not sub lake all the things you collect and throw it in one of them. No, you should know where the plastic go. You should know where the sharp go. You should know where the vial go. You should know where the this thing go. So all the things, gloves go. So all the things you should know one by one where to throw it. Got it? Can I start? The 4 dustbins. This is the new guideline. In the old guideline, we were having 5 dustbins, but now we have only 4. We have only 4 dustbins, 4 color coding: yellow, red, white, and blue. Can I start? Let's start with yellow. Can you see the yellow dustbin? Yellow dustbin contains what? Read, it is written: infectious non-plastic waste. Non-plastic, plastic kabhi nahi dalna yellow mein. It should be infectious non-plastic. All the human and animal anatomical waste. Human or animal anatomical waste, throw in yellow. Anything you are taking out of human body, any tissue, even a smallest tissue, you are doing a vasectomy and small vas difference. You are doing a tubectomy, a small fallopian tube. Whatever you are taking out of the body of the female, don't throw here and there. Throw it in the yellow dustbin. The animal tissue, animal skin. The third is the soiled. All the cloth or cotton which is contaminated with blood. So all the soiled one. Okay, all the expired medicine will go in yellow. All the chemical waste, solid and liquid, both solid chemical, liquid chemical. So this is all yellow. This is all yellow. Not only this, it contains the blood bank also. Not only this, it contains microbiology waste also. Can you please enumerate yellow with me? Can anyone help me in enumerating the yellow, please? Please help me for enumerating yellow. Yes. Number 1, human anatomical waste. Number 2, animal anatomical waste. Number 3, soiled waste. Number 4, expired medicines. Okay, these are the expired medicines. Number 5, chemical waste, solid, chemical waste, liquid. Then microbiology waste and blood bank. How many of you got it? So please learn all the things here. This is all yellow. This will all go in yellow. Let's come on red. The next is the red. Read what we will throw in red. Infectious plastic. The complete plastic will go. Kuch bhi. Plastic ka syringe, not needle. Plastic ke gloves, plastic ke tubing, plastic ka bag, catheter bag, endoscopic tube, all made up of plastic. In short, plastic will go in red. Red contain all the plastic, all the infectious plastic, such as tubing, bottles, IV set, catheter, urine bag, है ना, syringe without needle, gloves, plastic apron, plastic goggles. So all the plastic will go in red. How many of you got it? How many of you got it? Red matlab plastic. Okay, coming on white. The third one is the white. Actually, it's not white. It's translucent color. Actually, it's not white color. It's translucent color. This is translucent color. It contains all sharps. It is puncture proof. It is leak proof, and it contains all the sharp. है ना? The needles will go here. There are certain needles in which the syringe is fixed. वैसे I'm having a syringe, I'm having a needle. Syringe is plastic. It should go in red. And the needle is a sharp. It should go in white. But there are certain needles with fixed syringe. So that will also go in the sharps. That is in white. So here the needles will go. Either the needles or the syringes with fixed needle. Okay, and the blades will go, scalpels will go. So the sharps will go in white. And lastly, blue. Blue contain two things, the glass and the metal. Anything made up of glass. Anything made up of glass. Like the broken vial, है ना? Medicine vial, the slides, the test tube, the ampules, है ना? Or anything made up of metal, the dental implant, any other implant. So all the metal, the glass and metal will go in blue. How many of you got it? Huh? Tell me the 4 dustbins, please. Can you please tell me the 4 dustbins? What are the 4 dustbins I told you? Yellow, red, white, blue. Can you please enumerate in short? We will write it once. ठीक है? Yellow contains anatomical waste. Anatomical waste, whether human or animal. Not only this, it contains soiled waste, blood contaminated, or any fluid contaminated. Imagine the patient passed urine in the clothes only. What you will do with that clothes? You will ask them I'm sorry, to wash it and reuse? No, it should be discarded in yellow and incinerated. And all the soiled, any linen or cotton contaminated with human body fluid. Okay, all the drugs which are expired medicines, and all the chemical waste, solid and liquid, all the microbiology waste, and all the blood bags will be there. The red contain plastic, white contains sharp, and blue contain glass plus metal. Glass plus metal. This is in short you have to learn. Okay, let me ask you 2 questions now. Let me ask you 2 questions. I'm having gloves. Where should I discard? I'm having gloves contaminated with blood. The blood is there on the gloves. I'm operating the patient and blood is there. So gloves contaminated with blood. And here the gloves are there which are not contaminated with blood. Where you will throw? So if only gloves are there, I will consider them plastic, and plastic go in red. And if the gloves contaminated with blood, I will consider it as soiled. It is already soiled. I will throw them in yellow. I will throw them in yellow. In that case, I will throw them in yellow. Got it? I'm coming on your point, Anand. I'm coming. So I told you the 4 dustbins. Okay, I told you the 4 dustbins. Now, where we will throw the paper waste. The food we are eating somewhere, I'm drinking a coffee, I want to throw the mug, the paper mug. Or any food article. So where is the general waste I want to ask? General किस में डालोगे? Neither in yellow, nor in red, nor in white, or not in blue. The general waste कहाँ डालोगे? Paper waste, food waste. So this is all we require a 5th dustbin. But the color is not decided. You can use any color. The color is not decided. You can use black, you can use green, any. So for general waste, we use a 5th dustbin, for which color coding is not a guideline. You can use any color. How many of you got it? The summary is in front of you. Everyone have a look on the summary, please. So there is a yellow one which contain anatomical waste, soiled waste, expired medicine, chemicals, body fluid, clinical waste. There is red. Red contain the plastic, catheter, container, pipe, plastic bag, bottle. White contain the sharps. And blue, the blue one contain 2 things, glass and metal. Glass and metal. And the 5th dustbin we require. For the general waste, we require another dustbin for which color coding is not specific. You can use anyone. Jipmer uses black, you can use anyone. Got it? How many of you got it? So please learn that. You can see the 5 color. The 5th one can be any. The green, here green is shown to you. The kitchen waste, the paper waste, the tissue, the water bottles, the cans. So the general waste will go here. Got my point? It can be any color. The green is not fixed. But red contain plastic. Yellow contain, I told you, anatomical waste, soil waste. Blue contain the implants, that is metals and glass. And white contains the sharps. Say yes. Hana, you got it. In the end, you have to learn few logos. See the logo of biohazard. So there are 4 circles. One is complete and these 3 are incomplete circles. You can see these are circles like that. This is a symbol of biohazard. If this symbol is anywhere, that means don't touch it. It's biohazard. If C is written inside a triangle, it's cytotoxic hazard. It's cytotoxic hazard. The cancer drugs are there. So don't touch it. It can be mutagenic. It can be teratogenic. Don't touch it. Don't touch it. Okay. And you can see this is a symbol of radioactivity. So there is a circle and 3 triangle-like things are there. Cone-like things are there. So this is a symbol of radioactivity. Radioactive. Okay. This is a symbol of recycle. The 3 R, the 3 arrows. Look at the arrow. Look at the arrow. Look at the arrow. So the 3 R are reduce, reuse, and recycle. Try to reduce. Produce ही ना हो waste. भाई reduce ही करो, बने ही ना. बन गया तो उसको reusable बनाओ. वो भी नहीं हो रहा तो recycle कर दो. So try to do that. This is known as triple R technique. So this symbol can come in your exam. They will ask you identify. You have to write recycling symbol. This can come. You have to tick radioactive. This can come. This is biohazard. And C for cytotoxic. Very easy to identify. So these are the image-based question. You can get the image and they will ask you to identify for which this logo is used. Say something, react, respond. Got it? Got it? So we are done with this chapter also. We will solve the questions. How many of you are with me? We are done with this also. We will solve some questions. How many of you are with me? Read the question, tell the answer. The anatomical waste should be segregated in which color bag? Anatomical waste, human or animal? Yes, you are right. The anatomical waste is discarded in yellow dustbin. Okay, I told you it's in yellow. So whether human anatomical or animal anatomical, both of them are discarded in yellow dustbin. So correct answer here is yellow. Got it? Correct answer here is yellow. Okay, the next. Sharps should be segregated in which color? Sharps. Yellow, red, blue, or white? Sharps. I'm asking, be fast. Which is puncture proof, leak proof? Yes, you all are right. Very good. Very good. The sharps are discarded in white one. And now all the sharps. Plastic infectious item should be segregated in which color bag? Yellow, red, blue, or white? Plastic. Plastic kahan jata hai? The complete plastic go where? Complete plastic. Plastic infectious waste. The tubings, the catheter, the IV set, the syringes, the gloves. Complete plastic go in. I'm asking here. Yes, red. You all are right. The correct answer is the red. Okay, correct answer is red. Okay, so this is how you get many questions on that. Many questions on that. See, you got it or you didn't got it. So that is biomedical waste management, the 4 dustbins. The 4 dustbins. You get many questions on that. The newer guidelines you have to learn. Don't learn the old classification in which the waste is divided into 10 categories. Learn the 4 dustbins. Learn the color coding. Yellow contain what, red contain what, white contain what, and blue contain what. The 5th one contains the general waste and the color code is not yet decided. Does anyone have any confusion? Now, you have collected that in dustbin. So these are my 4 dustbin. Yellow, red, white, and now blue. You have put the corresponding waste here. Now what you will do? What you will do? So these dustbins are transported the place where this waste will be managed. So how to manage the biomedical waste? It will be transported. There is a central waste management area in every city. So in every city, there is a central biomedical waste management area. You will do the transport. Daily a garbage truck will come, collect all the dustbin. First, all the dustbins are collected at the central area of the hospital. There is a central biomedical waste collection area in every hospital where all the dustbins of entire hospital are emptied. They are collected. And from there, it is transported to the city's biomedical waste management area. And there they do the treatment. So what is the mechanism? How the treatment is done? There are 4 things we can do: mechanical treatment, thermal treatment, chemical treatment, and biological treatment. How many type of treatment? This is the treatment of biomedical waste. You have done the segregation. So there are 4 dustbin: yellow, red, white, and blue. So whatever waste is generated in the hospital, it is segregated in the 4 dustbin. Ab karoge kya unka? You have to treat it na. So treatment is done by one of the 4 way. Mechanical, thermal, chemical, and biological. So in the mechanical, we have 5 things: compacting, shredding, landfill, encapsulation, inertization. Don't go in the detail. कुछ important है यहाँ पे. Inertization is very important. यहाँ पे incineration is very important, है ना? So you get question on this or this only. But मैं सबका image आपको दिखा देती हूँ. Shall I show you the images? Let's start with mechanical. The 5 things in the mechanical. What is compacting? Compacting मतलब क्या? Compact the waste as much as possible in low waste volume. Reduce the size and volume of the waste. है ना? Compacting. Then shredding. Shredding में cut into multiple small pieces, especially plastic, rubber and soft metal. Cut it into multiple pieces with a grinder. So the machine is there. That is shredding. You can do the shredding for the plastics. The next is the landfill. है ना? There is a pit. गड्ढा बना दो, सब भर दो और बंद कर दो. Landfill. The oldest method. The next is the encapsulation. You take big containers, you fill it with the waste. है ना? You fill it with the waste, adding a immobilization material and seal the containers. Seal the containers forever. Encapsulation. The most important on which question comes, जो आपको याद करना है, is inertization. What is inertization? Mix the biomedical waste with cement. Yes. है ना? Take the waste, mix it with lime and cement. Lime यानी चूना and cement यानी cement, है ना? And water. So that it will become non-infectious. It will become non-toxic. The toxic waste converted to non-toxic by this method. You are inert बना रहे हो. You are making inert to the waste. That is inertization. Say it. What is inertization? Inertization में हम क्या कर रहे हैं? We are mixing the waste with lime and cement and water. So we are inertizing it. है ना? So 65% of the waste is mixed with 15% lime, 15% cement and 5% water. You have to learn the percentage, and it's a very important PYQ in your exam. What is inertization? So I told you what is compacting. Usko compact bana do. What is shredding? Cut it into multiple small pieces. Landfill, make a pit, fill it and close the pit. है ना? गड्ढा बनाओ, कचरा भरो, बंद कर दो. Okay. Encapsulation, take a container, fill it and seal the container. And inertization, mix the waste with what? Say lime and cement. You are mixing the waste with lime, cement and water. You learn the percentage also. Say people, समझ में आया क्या inertization क्या है? You got it? What is inertization? Whether you are learning others or not, it's not important, but you have to learn inertization. Got it? Inertization. These were the mechanical methods. Coming on thermal methods. Thermal में क्या क्या आएगा? Thermal में there are many methods: heat disinfection, hot air oven, autoclave, hydroclave, microwave, incineration, plasma, gamma irradiation. They are not important. I repeat my words. Important नहीं है. Just look at the image और आगे बढ़ो. है ना? The first is heat disinfection. Just heat the waste in boiling water. So it will get de-infected. है ना? Discontaminated, I mean. Okay, the next is the hot air oven. You may be knowing कि hot air oven में we will make the temperature 160 degree. है ना? It's an electronic instrument. इसके अंदर जो भी waste है उसको रख दो. At 160 degree, everything will die. Whatever bacteria, virus, fungus, they all will die. Autoclave. You know what is autoclave? है ना? Autoclave is steam sterilization. Steam is created और वो करेगी sterilization. है ना? Hydroclave, microwave, incineration. Most important is incineration. Incineration मतलब जला दो. Just put it on fire. है ना? So that everything converted into ashes. हिंदी में कहूँ तो राख बन जाएगा. आग लगा दो वेस्ट को, वो राख बन जाएगा. So there is an instrument. This is incinerator. Can you see inside it? This is fire. You are putting the waste here. है ना? And it is under fire. वो जल गया. It is burnt. That is incineration. This is incineration. So basically it's a high temperature dry oxidation. It's high temperature dry oxidation that reduces the organic waste into inorganic waste. Got it? Anna? So we are putting it on fire. Okay, so that is waste is converted into ashes. So there are two chambers here, primary and secondary. In the primary temperature, the temperature is 800. And in the secondary temperature, the temperature is 1050. Okay, so that is so which waste has to be incinerated? All the soiled product. Soiled linen, soiled cotton, जिस पे भी blood लगाए उसको जला दो. Just destroy it via incineration. But the sharps are never incinerated. Sharps को कभी मत जलाना. Don't put fire. Pressurized get container को नहीं blast हो जाएगा. Take a LPG cylinder and put it on fire. Everything will blast. Never put fire on pressurized gas container. है ना? Large amount of reactive chemical waste है, so don't incinerate. Photographic waste, the X-ray film. Have you seen the X-ray film, CT film, MRI film, the black color films, black and white? Don't put it on fire. It contains silver. It contains silver. Don't put fire the plastic bag. है ना? Plastic bags को government has banned. I don't know about your state, but in my state it's banned. We cannot use plastic bags. If we are using, it's a crime. है ना? So plastic bags should not be used because if we put fire on the plastic bags, it is producing poisonous gases. Na? So don't use them. है ना? The waste which contain mercury. Just suppose a thermometer is broken down. I want to throw it. Shall I put it in incinerator? No, no, no. Thermometer contain mercury. Mercury and cadmium should not be put on fire. So that is the things you could not incinerate. These are the contraindications you can say. Okay. So don't go in detail. Just learn यहाँ से inertization, यहाँ से incineration. ठीक है? That's it. Chemical में you know what are antiseptics. है ना? And biological. The last one is the biological. We are mixing the waste with compost and vermicompost. Vermicompost contain the earthworm. Can you see? Here we are mixing it with cow dung. Mix the waste with cow dung, especially the kitchen waste with the cow dung. गाय की गोबर के साथ mix कर दो. Okay, and that is used for the agricultural purpose. Vermicompost contain the earthworm. That's it. So don't go in detail. I have not seen question. Question सिर्फ दो ही चीजों पे आता है. See, incineration, inertization. If you want to learn all, it's good. If you don't want to learn, it's also good. There is not much question from this area. So not very important. We will solve some questions. The first question in front of you. Incineration is not done for cytotoxic drug, sharp, anatomical waste, and cotton contaminated by blood. For which waste you cannot perform incineration? I'm asking. For which waste you cannot perform incineration? I'm asking to you. What's the correct answer? I told you sharps should not be put in fire. You cannot burn the sharps. Okay, they will not be burnt. So correct answer is B. You know the contraindication. All are incinerated except the same question with a different options, I guess. Human anatomical waste, उसको जलाना है कि नहीं? Animal waste, infected soiled waste, and broken thermometer, which should not be put in fire. Incineration मतलब आग, इसका मतलब है fire, है ना? Thermometers should not put in fire because they contain mercury. Mercury and cadmium should not be kept in fire. So D is the answer. Biomedical waste when mixed with the cement, what it is known as? Incineration or inertization or shredding or autoclaving. Very commonly asked question. We are mixing the waste with cement and lime. What is it known as? Louder, louder, louder. Yes, it is known as inertization. So correct answer is inertization. Got it? Can we go ahead? We are done with chapter number 2 also. We are done with chapter number 2 also. So till now we have done 2 chapters out of 7. 5 more to go. Sab chote chote hain aise hi. So what 2 chapters we have done? We have completed biomedical waste management and we have done the disaster management. So these are small chapters, but yet you get questions from them. Okay, Ji. Can we move ahead? Huh? Can I move to the next one? So next one is occupational health. So let's start with occupational health, but I need water to drink. So you have to give me a break of 5 minutes. After 5 minutes, I will be back. Hana? So I don't have water here. So I have to go and I will be back. Okay. So just a break for 5-7 minutes and we will be starting with chapter number 3. So in a single go, we will complete the remaining 5 chapters. Hana? Occupational health, genetics, mental health, social science, and history. So all these 7 chapters, the small bulk will be completed today. Okay, and after that, if the time is allowing, we will start. Of course, we will start biostats today. These are small chapters. उसके बाद biostats और करना है. Done. So major chunk in PSM will be done today. Okay, so let's take a small break. है ना? Okay, I will be back in 5-7 minutes. I will be back. Okay, so I guess I will be back at 3:25. I'm not ending the link. I'm here only. Am I back? Can we continue? Are you people there? Kindly someone respond, please. Okay, let me open this also. Okay, Ji. Can we start? Okay. The next chapter is occupational health. So what is occupational health? It is the highest degree of physical, mental, social well-being of the workers in all occupation. You know, everyone has different occupations. Some are doctors, some are engineers, some are lawyers, some are clerks. You know, so everyone is in different occupation. You know? So at the occupational place, everyone goes nowadays. Work from home is a very common culture, but initially work from home was not a common culture. Okay, so everyone goes to their place. You know? Doctors goes to hospital, the lawyers goes to the court. So at their workplace, they should get the highest degree of physical, mental, and social well-being. So the highest degree of physical, mental, social well-being of the workers in all occupation is known as occupational health. Okay, so there should be an equilibrium between the worker and its environment, occupational environment. Where the worker is working, the environment should be, and the worker should be in equilibrium. That is occupational health. Now there is a term on which question come. It is known as ergonomics. Ergonomics means fitting the job to the worker. It is not anyone can do any job. You got my point? Hannah, just suppose there is a person who is having anemia, who's anemic. I cannot allow this person to work in a factory where lead is used because lead will exaggerate the anemia. There is a person who is having color blindness. I cannot allow this person to become pilot. And a pilot should have vision acuity. So we cannot allow any color blinded person to become pilot or to become a driver like that. So fitting the job to the worker, fitting the job to the worker according to the health. That's why nowadays in many companies and corporate, you may have seen before appointment, they ask for medical checkup. They always ask for the medical checkup and they see the reports. Based on that, they decide whether the person is fit for this job, yes or no. You may have seen it is a culture in many corporates. Even in the army and everywhere, they first do a medical checkup of the person. If the person is fit enough to for that job, then only it is assigned. So this is known as ergonomic. What is the term you should understand? The term is ergonomic, fitting the job to the worker. Learn this line. Ergonomic ka matlab yaad karo. How many type of occupational hazards are there? Now at the occupational place, the person can have diseases due to physical agent present at that place. There can be chemicals present at that place. There can be biological agents causing the disease. There can be occupational cancers also. Yes, I will tell you some occupation in which cancer is common. I will give you the list. Occupational skin diseases are common. Dermatitis, and occupational accidents are also common, and diseases of psychological origin. Then this is very common nowadays when the boss is torturing the employee. So psychological disorders are also very common whenever the pressure and targets are more. Got my point? So these all are occupational hazard. Due to the job, the patient is losing the health, not the patient. The person is losing the health and having certain disorders. That is known as occupational hazard. How many of you got it? So I will teach you these one by one. Let's start with the physical. Let's start with the physical. Now, some companies, not companies, some factories are very hot. There is abundant of heat inside the industries and factories. So that can affect the direct effect, indirect effect, hot spots, radiant heat, stagnation can be there. High temperature. In high temperature, the person can have cramps. The person can have hyperpyrexia, heat exhaustion, heat strokes can be there. Sometimes in extreme cold, the frostbites are common. You know what are frostbites? I forgot to put the images. Let me see. It's there. Okay. So frostbite ka to image nahi hai. In light, this is the light. In light, in this light, welding light. In welding light, minor nystagmus is common. Minor nystagmus can be common here. Okay, so you have to learn this nystagmus. And in vibration, if a person is working constantly in vibration, the hands are working on a machine that is constantly vibrating, white fingers can happen due to the vibrations. Due to the vibration, you can see. Say yes, and the minor nystagmus is different. I'm sorry. This is I have shown you the welder's flesh due to UV light. If the person is exposed to UV light in welding, we have seen don't watch the welding. It's always said. So during the welding, it's UV light, and that can cause the welder flesh because of the welding. Welding कराते हैं ना, iron की welding कराते हैं लोहे की. So welding में welder's flesh हो सकता है तो जो welders होते हैं उनमें ये बहुत common है. The person who works on the machine who vibrate constantly, unme white fingers are common. Okay. And due to extreme noise, in some machines there is extreme noise. The person can become deaf. The person can become permanently deaf because of that noise also, है ना? According to the Factory Act, more than 90 decibel for 8 hours is not allowed. This is the maximum permissible limit. This is the safe limit, beyond which the person can have hearing loss. Okay, according to WHO, it's 85 for 8 hours. So according to Factory Act, it's 90 decibel, and according to WHO, the maximum permissible limit is 85 decibel for 8 hours. If the noise is more than that, person can have trouble in the ears. So that is the thing. So these all are physical agent: the heat, the cold, the light, the noise, the vibration, the UV light. Don't learn, just take the catchy word. How many of you got it? Got it? This is the occupational में physical one. In the chemical one, someone is working in an environment where toxic gases are there, dust is there, dust leads to pneumoconiosis. Aerosols can be there, that is chemical. In the biological hazard, someone work in a factory, industry, where the, funguses can be there, है ना? Some bacteria can be there that can lead to corresponding disease. Okay, don't learn the list. Occupational cancers are important. Occupational cancers में most common cancer is skin cancer. Someone who is working in tar, someone who is working in radiation, that can have skin cancers, है ना? That can have skin cancer, lung cancer, bladder cancer. The one who is working in aniline dye. In the end, I will give you the list. Okay, and occupational dermatitis is also common. Occupational accidents can be there. Someone can fall. Head injuries are very common in the workers. And they fall over the stairs. And psychological, I told you, na, the traumatic neurosis can be there. The targets and all. So these are the various types of occupational hazards. Not much question could come from that, but you should know. See the question which are already there, the PYQs. White finger may result from which of the following occupational hazard? White finger. Is it due to heat, cold, UV radiation, or vibration? White finger. What is the correct answer? Fast. Yes, white finger is due to vibration. I have shown you the image also. Someone working in the vibration on the machines constantly with the fingers will become very hard. The skin become hard. It is known as white finger. Okay, welder flash will result from which occupational hazard? Heat, cold, UV light, or vibration? Welder's flash in the light, in the eyes. What is the correct answer? Welder's flash in the eyes. Yes, you all are right. The correct answer here is UV radiation. I told you. Now here I am coming on pneumoconiosis. What is pneumoconiosis? Due to the occupation, the person is exposed to certain type of dust. Any dust particle that is 0.5 to 3 micrometer. 0.5 to 3 micrometer. If someone is inhaling, that will go in the lung and produces a disease known as pneumoconiosis. So pneumoconiosis is due to dust. The dust can be of different type. If the dust is silica dust, it leads to silicosis. If the dust is coal dust, it is known as anthracosis. Anthracosis, please learn. If the dust is asbestos dust, it will lead to asbestosis. So different factories, different companies, different industries uses different thing. So someone working in a silica factory will have silicosis. Someone working in a coal factory will have anthracosis. Someone working in an asbestos factory, that will have asbestosis. Cotton fiber lead to bicyanosis and sugarcane leads to bagosis. How you will learn? Bicyanosis, bagosis, दोनों पे repeated PYQ आता है. So bicyanosis is due to cotton and bagosis is due to sugarcane. So you can learn basu. Bagosis is due to sugarcane. Basu. And you can learn baiko. Bicyanosis is due to cotton. So it's a mnemonic I can tell you. Baiko and basu. Baiko and basu. You can learn like that. So sugarcane, bagosis, and cotton, bicyanosis. This is one mnemonic I have. In the last class, some of the students tell me sugarcane is ganna. Ganna bag में भर के भाग जाओ, है ना? गन्ने को bag में भर लो. That was a mnemonic he told me, so I'm telling you. You can learn like that also. So sugarcane is in the bag. In the bag there is a sugarcane. You can learn like that, है ना? So bag, sugarcane, bagosis. You can learn like that also. And bicyanosis is cotton. Okay. So can we go ahead? Yes, bag of sugar. You can learn that also. So whatever the mnemonic you are learning, please learn that. Beryllium lead to berilliosis. It's okay. There is nothing important in that. Molder's hay, which contain a fungus that is Microspora feni, it leads to farmer's lung. Iron dust lead to sidrosis. Tin dust lead to stenosis. Bird dropping, the excreta of the bird, the feces of the bird. If someone inhale that, it's very small. It can lead to bird fancier lung. And aspergillus lead to compost lung. So please learn. इसमें से PYQ किस किस पर है? On which you have the PYQs. These all are pneumoconiosis. There is a PYQ on coal. There is a PYQ on sugarcane and cotton, both of them. There is a PYQ on mold hay. These four are repeatedly asked PYQ. Please learn. The coal dust is anthracosis, cotton fiber is bicinnosus, sugarcane is bagosus, and mold hay, that is Microspora feni, is farmer's lung. These are repeatedly asked, but question can come from anyone. What is the size of the dust? It should be 0.5 to 3 micrometer. If it is less than that, if it is very small, less than that, less than 0.5 micrometer, so it will show the Brownian movement. It will not cause the disease. And if it is more than 3, it will get deposited in the nose only. It will not go inside. So not more than that, not less than that. In this range only, the dust will cause pneumoconiosis. So learn the various types of pneumoconiosis. I am done. Read the question, tell me the answer. Inhalation of sugarcane does lead to what? Bagosus, bicinnosus, tuberculosis, or farmer's lung? You get simple questions on that. Sugarcane. I told you a mnemonic also now. Basu, or bag of sugar. So it's bagosus. Yes, you all are right. The correct answer is bagosus. Everyone, give me the answer. The correct answer is bagosus. And the next question, you got it. Inhalation of cotton fiber dust leads to what? So I told you one more mnemonic, bico. The mnemonic is bico. So it's bicinnosus. It is caused by cotton fiber. So bicinnosus is caused by cotton fiber. So in that case, answer will become B. So you get many questions on that. The next topic is the lead poisoning. Lead poisoning is a topic. Okay. So lead poisoning can also occur as an occupational hazard. In some factories, the lead is used. Lead batteries. For example, there are lead batteries. Someone working in the lead battery factory. So he is constantly exposed to lead poisoning. It is known as plumbism. It is also known as sternism. It is also known as painter's colic, because lead is present in the paint also. The one who is doing the painting on the walls, जो color करता है घर को, painting करता है, उसमें ये common मिलेगा. Most common route is the petrol contain the lead. We all know petrol contain the lead. So whenever there is a vehicle, you can see the smoke is coming out. This smoke or exhaust contain the lead. Or if someone is inhaling it too much, the person can have lead poisoning. So most common route is inhalation. Inhalation of the smoke or the dust coming out of the vehicle, because the petrol contain the lead. This is the most common cause. It's a question. Got it? What happened? Just a second. So most common route is inhalation, followed by ingestion also, rarely eating, and followed by skin. Through skin also it can enter, but most common is inhalation. So what will happen? You can see. Just a second. May I have some mnemonic? No. You can see the person have anemia. Number 1, anemia. Person have anemia. Which anemia? Microcytic hypochromic anemia. Number 1. Number 2, patient have Bartolian line. Bartolian line, it is a lead sulfide line on the gums, upper jaw. Can you see? This is lead ka line ban gaya hai, upper jaw pe, Bartolian line. So I will say A, B, C. C is CNS defect. CNS effect. Patient have some CNS effects all there. C. And D is not there. A, B, C, D. E is not there. F is there then. Facial pallor. Facial pallor is also common. The facial pallor due to anemia. Okay, so you can learn like that. Apart from that, punctate basofilling is there. Can you see inside the RBC? The punctate basophilia, the dot like structure. The punctate basophilia is common. Lead colic. C for constipation also we can learn. C for CNS effect, C for constipation. P for palsy. The patient have palsy. You can see. The wrist drop. The wrist drop and foot drop is common. And lead encephalopathy. In the brain, it's encephalopathy. So you can learn these are the features of the lead poisoning. Okay, the same is shown to you. So that's the thing. Treatment is EDTA. Occupational cancers. I told you, cancers occur in some occupation. So the one who is exposed to asbestos, the person can have mesothelioma. Where is asbestos present? Asbestos present in the tuna. It is present in the tuna, in the lime. The one who is doing the painting can have this problem, asbestos. It is exposed, the person can have mesothelioma. The person who is exposed to arsenic can have skin, lung, and liver cancer. The person exposed to the benzene can have leukemia in future, the blood cancer. The person who is exposed to benzidine, the person will have urinary bladder cancer. Beryllium is a risk factor for lung. Cadmium is a risk factor for lung. And chromium is a risk factor for lung and nasal sinus. In them, question already asked on beryllium, benzidine, and benzene. Both of them are confusing. Benzene leads to leukemia. Benzidine leads to urinary bladder. And there is also a question on asbestos ka mesothelioma. Please learn. These are the occupational cancer. So anyone who is working in a factory or anything and in close contact with these should be beware. They can have cancer anytime in their life, the corresponding cancer. These are occupational cancer. The person is having cancer because of the occupation. उसका occupation ऐसा है इसलिए उसे ये वाला cancer हो रहा है. These are occupational cancer. The list is not ended here. You can read the list and continue the list. I'm not reading it completely. Vinyl chloride is ultra important. Vinyl chloride leads to angiosarcoma of liver. Angiosarcoma of liver. Please learn that. Hana, can we go ahead? So most common cancer is skin cancer. In the skin, occupational cancer में skin cancer है और उसमें भी squamous cell carcinoma is the most common. Most common is squamous cell carcinoma. Are you getting it? So that is the occupational hazard we have seen. The various diseases in the occupational hazard. The patient have the disease because of its occupation. वो उस काम में है इसलिए उसको ये disease है. Like doctors always have mental pressure. That's why doctors many times the doctors have MI, they have stroke due to the stressful life. So because of that occupation, that particular disease is occurring. So that is known as occupational hazard. How many of you got it? How many of you got it? Say something, respond. I will show you the questions also. Anna, the next is sickness absenteeism. Anna, absenteeism matlab absent. You are absent on work. Why you are absent on work? Because you are sick. Imagine I'm applying a sick leave in my hospital that I will not be coming for the hospital for the next few days. I'm not well. So that is sickness absenteeism. So it is an index in an industry to assess the state of health of workers. Now imagine I'm an investigator. I'm a supervisor of the occupational health. Now there are guidelines कि occupational health में आप किसी भी worker से कितना भी काम नहीं करा सकते हो. There are few guidelines. You have to give a good environment, a safe environment to the worker. I will tell you that in Factory Act, है ना? So in any factory, if I'm the owner of the factory, I'm the director of a factory, I'm having a factory. Under me, hundreds of workers are working under me. I pay them. So I should provide them a safe environment, a good environment, a healthy environment, so that they do not fall sick. It is my responsibility. And there is a committee who checks it regularly. The Factory Act is there. Otherwise, the workers who are working, they can complain for me that we work in a factory. The name of the owner is this, and they do not provide us a good environment. A safe environment, a healthy environment. And we are exposed to this, and we can have diseases for that. So I can be under legal action. Got my point? So that is the thing. Okay. So if I want to judge in any factory, I'm having multiple A, B, C factory. So which factory is giving best health to their workers? So I will check the register of absenteeism ka register dikhao. In a factory in which the workers are taking less leave, that means there the health of the worker is good. The environment is good. That is providing good physical, mental, and social well-being to the workers. And in a factory where the absenteeism is too high, very frequently the workers keep on absent. That means they are not happy with their job. They are not finding it suitable. They are getting sick again and again. Either they are actually sick or they are making an excuse of sick because they do not like their job. They do not want to attend it. They do not want to come. Got my point? So that is sickness absenteeism. It is the most useful index to judge the health of worker in a factory, in an occupation, I must say. How many of you got it? Usually in 1 year, 8 to 10 days are allowed in complete 1 year, apart from Sundays and national holidays. 8 to 10 days are allowed. That is sickness absenteeism. I don't want to work. Anna? Okay. It can be due to economic causes, social causes, medical causes, occupational, non-occupational causes. Anything can be the reason. If you want to reduce the sickness absenteeism in your factory, I'm the owner of a factory. I'm having hundreds of workers. I do not want anyone unnecessarily do a leave. Unnecessarily they do not come on their job. So I should provide a good factory management to them. I should provide good practices to them. I should do a pre-placement examination. The person who is fit for the job, that person only I will place. Before appointing any new worker, I will order a list of investigation. I will ask them to go to the doctor, get examined, get a fit certificate, do this investigation. If everything is normal, then only I will appoint you. Because if you are appointing a person who's already sick and having some disease, then the person will keep on taking leave again and again. Not good for him also, not good for you also. Okay. Good human relationship you have to maintain. Hana? Application of the ergonomics. Why? Fitting the job to the person. Right job to the right person. So by these ways, the sickness absenteeism can be reduced. Got it? Read the question, tell me the answer. Nearly 3/4 of the occupational cancer are which cancer? Skin cancer, lung cancer, bladder cancer, or leukemia? I'm asking for a term occupational cancer. The cancer due to occupation. Which cancer are most common? Occupational cancer may say. Skin cancer. And that too squamous cell carcinoma. Squamous cell carcinoma are most common. Okay. Now I will teach you two legislation here. The Factory Act, नाम में ही है, it is applicable on all factories. Factory Act, I will teach you Factory Act, है ना? And then I will teach you ESI. Have you heard about ESI Act? I will teach you that also, है ना? So let me start the Factory Act. नाम में ही है, Factory Act is for all the factories. अच्छा, what is a factory? What is a factory? Define factory किसको बोलोगे? What is a factory? Any place, there is a establishment where more than 10 people are working, where power is used. It is an electronic factory. I use the power to make some product, है ना? And more than 20 people are used, where no power is used. Just suppose I'm doing some handicraft. I'm having 20 employees working under me, and they make sweaters, woolens. So electronic is not required. No electricity is required. There are females, they are coming and doing some handcraft. So it is also a factory, but the minimum, it should be 20, more than 20%. In a power, where power is used, the minimum is 10%, where no power is used, minimum is 20%. So that is a factory. That is a factory. To whom you call a factory? Any establishment, more than 10 people, where power is used, and more than 20 people, where no power is used. How many of you got it? How many of you got it? The definition of the factory? Please learn the definition of the factory. Any establishment, more than 10 people, where power is used, and more than 20 people, where no power is used. So factory can be of any type. There can be a big factory having machines run on electricity. So here power is used. And there are many factories, the handcraft, the sweater, the weaving, the painting. So here no power is used. I don't require machines. I just require the person, and they, from the raw material, they are making the products. I don't require power. So no power is used, it's 20. So Factory Act is applicable on all. Factory Act is applicable. Now there are certain factories like cracker. The factories come before Diwali, and after Diwali they just go away. The color, the color, jo Holi pe colors are used. It comes before Holi, and after that it goes away. So there are many factories which are seasonal. They come in a particular season and they go away. And they are perennial. Throughout the year they work. So the Factory Act is applicable on all factories. So Factory Act is applicable on all the factories, whether the factory is seasonal or perennial, whether the factory is power using or non-power using. On all of them, the Factory Act is applicable. In any factory below 14 years of age, you cannot give the employment to child. No, it's a crime. You cannot give employment to any child who is less than 14 years of age. It's a crime. So you cannot do that. Number one. What about 15 to 18? This is adolescent. Can I employ? I am the owner of a factory. I'm having a factory in which some product, food product is there. And I'm having a factory of some noodles or anything. Okay, I'm having a factory. I require multiple workers to work for that. So below 14 years, I will not give employment. I will check the Aadhaar card, I will check the ID, and I will see the ages more than 14. If it is less than 14 and I am giving the employment, I am under legal action. So I am under legal action, and I can be sued for that. But what about the 15 to 18? Adolescent. Adolescent should be checked by the doctor. And if the fitness certificate is there, certifying surgeon is giving the fitness certificate, then only you can put them on the work. You can work them from 6 a.m. in the morning till 7 p.m. in the evening. You cannot, adolescent, say night shift is not allowed. Night shift is not allowed for the adolescent. If I'm holding any adolescent, boy or girl, both, for the night shift, I'm under legal action. I cannot do so if I'm the owner of a factory. So it is not allowed to hold any adolescent for night shift. After evening 7 p.m., I cannot hold any adolescent. So I can make them work from 6 a.m. to 7 p.m. depending on the jobi wages I'm giving, the payment I'm giving on that. And in dangerous occupation, the adolescents are not allowed. So these are the work related, depending on the age, these are the norms. These are the norms. How many hours I'm allowed to take work from I'm the owner of the factory now. How many hours I'm allowed to, my workers will work for me. In one day, maximum 9 hours. I cannot make anyone to work more than 9 hours in a day. If I'm doing so, I am not doing right. Under Factory Act, I can be under legal action. Okay, maximum 48 hours per week. In a week, I can make work them maximum 48 hours. So 9 hours in one day, 48 hours in a week. What about overtime? If someone is required of money, the person is saying, ma'am, I'm requiring more money. So can I do the overtime? I will give extra hour. You give me extra money for extra work. So I will say, okay, I need work. You want money. So, okay, you do extra work. I will give you extra pay. So overtime ke baad bhi, I cannot make them to work more than 60 hours. If the person wishes, then also 60 hours in a week. With overtime also, with normal wages, maximum 48. With overtime wages, the extra payment also, I can make them work only for 60 hours per week. If I'm doing more than that, I can be under legal action if someone does the complaint. Say yes, got it. So these are the norms for the Factory Act. Say something, people respond. So maximum hours normally 48 hours per week. And overtime ke saath, it's 60 hours per week. How many of you got this point? Huh? And there is a leave with wages, paid leave. It is known as paid leave. If someone is doing a leave, I will not deduce the wages. I will not deduce the payment. So every 15 days, 1 day is paid. Apart from Sundays, 1 day is paid. So per person, the worker can do a one leave every 15 days. And I will not deduce the wages. Every 15 day one. And the person can do the accumulation up to 40 days and go on a vacation. So every 15 day one, again 15 day one, so again 15 day one. Likewise, the complete year, it will be 24 leaves. And the person can go on a vacation that I have accumulated my leaves, and no one for these 40 days is going to deduce the money. He will get full wages. Okay, so that is paid leave. So you should learn these norms. And now I am the owner of a factory. Now I want to build my factory. I want to construct it. So there should be minimum how much space should be provided. It should not I'm giving a small space and I'm filling multiple workers inside that. It's very overcrowded, congested, not a good environment. No, each worker should have a minimum of 500 feet cube, this much of space. It should be good. It should be spacious. It's not overcrowded that everyone ek dusre se takkar ho rahi hai. It should not be like that. The minimum space given to the worker, it should be 500 cubic feet per worker. One safety officer should be there over 1,000 worker. If I'm having a big factory at big level, I'm working. So every 1,000 worker, I will appoint one safety officer that is concerned with the safety of these workers. That will work for the safety of the workers. Every 500 workers, I'm having a welfare officer. So in every 1,000, 2 welfare officer and 1 safety officer. Every 250 worker, I should build 1 canteen. 1 canteen should be available for the workers. Every 250, 1 canteen. And every 30 women worker, there should be 1 crèche. You know what is crèche? Now, the women have children. They always have children with them. So where they will keep their children? They cannot leave their children alone. The father is also going, the mother is also going. Who will take care for the children? So they can carry their children in the factory. So there is a small room, a play area type. They can leave their children there and they keep on working. So they have an eye on the children also and they can work also. This is known as crèche. Every 30 women, there should be 1 crèche, the play area for the children. It's not so beautiful, but yeah, it's like that. So these are the guidelines. How many of you got it? This is Factory Act. This is Factory Act. So can anyone enumerate me the guidelines of the Factory Act? We are done with Factory Act. Tell me, sabse pehle tell me what is a factory? Definition of factory. Any establishment in which more than 10 people are there, where power is used, and more than 20 people are working, workers are working, where there is no power is used. That is known as factory. Okay, this is a factory. Now, there are some factories which are seasonal. There are some which are perennial throughout the year. Factory Act is applicable on all. Power, non-power, seasonal, perennial, on all of them, the Factory Act is applicable. I'm the owner of a factory. I'm opening a factory. Maybe seasonal, maybe perennial, maybe power, maybe non-power. So Factory Act is applicable on my factory. Now, what are the norms? What are the guidelines? So tell me the age-related guideline. Tell me the how many hours I make work, that is time-related guidelines. And tell me this guideline, the safety-related guidelines. So age-related guideline, I cannot give employment to anyone who is below 14 years of age. In 15 to 18, I require a health certificate and fitness certificate, and I cannot hold them after 7 p.m. Night shift is not allowed. R-wise, the guideline is that the maximum hours in a week is 48 hours per week. I can make work. With overtime, overpay, it should be 60 hours per week. Imagine a worker is very poor and he requires money. Deadly, he requires money. He's saying, ma'am, I will work 24 hours for you. The 24 into 7, I will keep on working, but you just give me money per hour. Overtime you give me. So I will not allow. Maximum I can give him 60 hours per week. And with overtime, overpay. Apart from the routine. More than that will be inhuman. Maybe the person is needy, he can ask, but I cannot give. I will be under legal action. Okay, so that is the thing. And 9 hours per day. Per day के हिसाब से it's 9 hours. Not more than. अब 48 है तो person बोले एक 24 hours पूरा कर लूंगा और दो 24 में पूरा कर लूंगा. So it's not कि 24 hours में you just complete 48 hours. So every day maximum 9 hours, like that. It should be splitted. Okay, so that is the thing. And regarding the safety, I told you the norms. There should be minimum 500 feet cube, this much space available to each worker. There should be every 500 worker one welfare officer, every 500 worker. There should be one safety officer every 1,000 worker. There should be one canteen every 250 worker, and there should be one crèche है ना, the play area for the children, every 30 female workers, 30 female workers. If there are 60 females in your factory, you should have 2 crèches. If there are 500 people worker in your factory, you should have 2 canteens, like that. So these are the norms that should be followed according to the Factory Act. I guess I'm done. Say something, people. And yeah, forgot to tell you the leave with wages. Every 15-day, one leave. Okay, G. Hana, coming on the next act, ESI. What is the full form of ESI? It's like a health insurance. The health insurance which is provided by the government. Anyone can take the ESI insurance. The one who is falling in this category, I will tell you the criteria. It's the health insurance. I guess every one of us have the health insurance. After COVID, of course, everyone have. Hana. So there is no certainty of life. You should have health insurance of you and the family. Hana, health insurance. ESI is a health insurance which is given by the government. No, Factory Act and ESI both are launched in 1948 only. Okay, the full form of ESI is employee state insurance. Employee. And I'm the owner of a factory, company, industry. There are many employees working under me. And not only factory. Factory Act is applicable for factory, but ESI is applicable for everything. So ESI, this is the logo of ESI. You can see there is a, what do you say? दिए को क्या बोलते हैं? There is a, क्या कहते हैं इसको, है ना? And you can see the flames. These are the flames. Okay, so these are multiple, 5 flames are there. You see, Anna, this is the logo for ESI. You should be able to identify that. Anna, it includes all the factories in India, excluding three factories. It is MDR. Anna, you can learn MDR. Mines, defense, and railway. Mines, defense, and railway is not included. Excluding that, everything is included under ESI. So we don't give ESI to mines, the person who is working in mine, the person who is working in defense, like army, navy, and the person who is working in railway. We don't offer ESI to them. Rest all the people can take the ESI. Anyone who is earning less than 21,000 per month. How much you are earning? 21,000 per month. Any employee who is getting income less than 21,000 per month can enroll for ESI. So at least minimum income, it should be less than, maximum income is 21,000. It should be less than per month. If anyone who is earning less than 21,000 per month, that can enroll for ESI. The person has to enroll for that. It's voluntary. Okay, it covers all the state in the India except Manipur, Sikkim, Arunachal Pradesh, Mizoram, and Union Territory of Delhi and Chandigarh. Here it is not still applicable, but rest of the India it covers. It don't cover MRD, mines, railway, and defense. And anything else is covered. All the shops, all the hotels, all the restaurants, all the cinemas, all the theaters, road motor transport, all the educational institute, all the coaching institutes, any worker working in any of them. Imagine a waiter in a restaurant. Imagine a person working in a theater. Anyone who is earning less than 21,000, he is the employee. He is not the owner. He is the employee. So he can enroll for ESI. He or she can enroll for the ESI. Say yes. So the Union Ministry of the Labor is the chairman of ESI. It's also a question. Union Minister of Labor. That is the chairman of ESI. So, whenever we take health insurance, have you ever taken health insurance? You have to pay a premium amount. First, you have to pay a premium amount, which is very nominal. And after that, the government, the insurance company give you an insurance of certain amount. So whenever the person falls sick, the treatment will be free of cost. Because the person has already paid the premium. So how much premium has to be paid? What about the finances? Who will pay the premium? Who will pay? Employer is the boss. He is the boss of the factory, company, whatever. And employee is the worker. I guess everyone can understand. So the boss will pay 4.75% of the total wages. And the employee will pay 1.75% of the total wages. Got it? So total, this is how it is paid. Just suppose there is a person who worked 10,000. तो उसको कितना पे करना पड़ेगा? 10,000 का 4.75% कितना होता है? 4.75%. It's 475 rupees. So 475 rupees every month the boss will pay, and 175 rupees the worker will pay. Every month they have to pay. If so, worker has to pay only 175. The boss of that, like the employer of that factory company will pay 475, है ना? If the person is earning 10,000, less than 21,000 कुछ भी हो सकता है. So that उसकी जो total wages है, monthly wages, उसका एक percentage every month is given as a premium. Every month is given as a premium. Now when the person will fall sick, now free treatment will be provided. So उसका खर्चा कौन करेगा? कौन करेगा? Central government की state government? So both will do 1:7. State government will do 1 and central government is 7. So that is the expenditure on the medical expenditure. So when this person will fall sick, every month he is paying 175 rupees, 175. So he is insured. Once he becomes sick or any of the family member of this person is sick, he will get free treatment. The costing is beared by the government, state and central both, 1:7. This is the finance. How many of you got the finance? How many of you got the finance? Huh? What benefits you will give to this person? Full medical benefit. Full medical. So there are ESI hospital. If he's having any disease, that will be treated free of cost. For diagnosis, for treatment, no money will be taken from. It's an insurance, health insurance. Hana? So he will be given full medical care free of cost. Hana? Sickness benefit, extended sickness benefit, enhanced sickness benefit. There are 3 sickness benefit. What do you mean by that? Sickness benefit means if anyone is sick during the 365 days of a year, up to 91 days, the person can take a leave because of sickness. The person is sick, he has to write an application that I'm sick, I will not be able to come on the job. So 70% of the wages will be given during those days. Person is not coming, person is at home, I'm sick, I'm a worker in your factory, you are the boss. So I will give you, sir, ma'am, I'm not good, I'm not feeling good, I'm sick, I'm having this disease, these are the reports, I will not be able to come for the next 20 days. So I have sent you the application. For the next 20 days, you will not deduce my pay. You will not reduce my payment. You will give me 70% of the payment. At least 70% to mil raha hai, baithe beta hai. So 70% of the payment will be given to me for those 91 days in a year. It is not in continuation. I can take in split 20, 20, 20, 24 times, like anything. So up to 91 days, I will be getting 70%. 91 days se zyada hai to deduction is possible. So that is the benefit. Number 2, there is a list of 34 disease given by the ESI. So you don't have to learn the list. These are the chronic disease like TB, some cancers, like there is a list of 34 disease. In that, up to 2 years, the person will get 80% of the wages. It's like pension. Person is not going for the job. For 2 years, the person is taking the treatment for the disease. Person is at home or hospital admitted. पहली बात तो treatment भी free में मिल रहा है और ऊपर से wages भी मिल रहा है So पगार भी नहीं कट रहा और treatment भी free में मिल रहा है. So double फायदा. You are getting the free treatment. Number 1, the worker is getting the free treatment and the deduction of the wages is not there. So 80% of the wages is given up to 2 years for only 34 diseases. But it should be certified that person is actually having that disease. So there should not be foul play in that. Okay. And enhanced sickness benefit. Now, if some male is doing vasectomy, up to 7 days full wages is given. The person after vasectomy, take rest for 7 days. Don't come to the factory. Take rest for 7 days at your home only. None of the wages will be reduced. You will get 100% wages. But for more than 7 days, we will do the deduction. And if a female is doing tubectomy, I'm the owner of a factory. There is a female worker in my factory and she is doing tubectomy. So she has attached the reports and sent it to me, ki ma'am, I have done this tubectomy. So up to 14 days, she is having free leave. 100% wages we will give. And for 14 days, she can take rest. Tubectomy is a big surgery. Vasectomy is a small surgery. So in vasectomy, 7 days rest is sufficient. In tubectomy, 14 days rest is required. So here, 100% wages are there. So tell me 3 sickness benefit. First, medical benefit. And 3 type of sickness benefit, enhanced sickness benefit and extended sickness benefit. Pehle extended hai, fir enhanced hai. So medical benefit, sickness benefit, extended sickness, enhanced sickness. Can you please tell me? Medical benefit, they will get everything free. Free medical care. The treatment will be free. Sickness benefit up to 91 days in a year, 70% wages will be given. In extended sickness, up to 2 years, this is 91 days. This is up to 2 years. 80% of the wages is given only in case of 34 diseases. So list is there. And enhanced, 7 days for tubectomy, vasectomy, and 14 days for tubectomy, but 100% wages is given. So please learn 2 things. I guess you got it. Learn the duration and learn the percentage of the wages. The person is getting free without coming to the job. So these are the benefits of the ESI. Not only this, see. So there is maternity benefit also that I'm telling you separately. Apart from that, there is disablement benefit. Someone is having disablement. Just suppose there is a worker in my factory and have a fracture. है ना? He's having disablement, but it's temporary. है ना? So I will give 90% of the wages. He should take care till recovery. Pura fracture jab tak 2 months, 3 months, 4 months, the fracture is not subsided, I will give 90% of the wages. Person is not coming. है ना? If the salary is 10,000, I will give 9,000 without the person coming to the job. है ना? Permanent disablement. Person got paralyzed permanently. He will not come to the job again. है ना? We will give 90% of the wages throughout the life as a pension to that person. है ना? If the person is dead, suppose I'm the owner in my factory, there is a person who works and he's dead. So I will give 90% of the wages to the family, to the spouse, as throughout the life. है ना? To the children. The children less than 18 years. More than 18 years children, I will not give. The dependent, because I will not consider them dependent. They can earn of their own. But the spouse I will give. If the husband is working, I will give to the wife. If the wife is working, I will give to the husband. The spouse will be applicable for the pension. Okay. And funeral. For apart from that, 10,000 cash will be given on the day of the funeral. Okay. And rehabilitation benefits. So these are the benefit. Maternity mein mujhe batane do. Maternity benefit. So this is the summary. Maternity benefit. You know what is confinement? Successful delivery. If there is a female in my factory, I'm the owner, there is a female working in my factory, she got pregnant, है ना? So throughout the pregnancy and after delivery, anytime she can take 26 weeks of leave, and that will be paid 100% wages, 100% wages, free wages, है ना? I will give 100% payment up to 26 weeks. You can calculate how many months. 26 week मतलब कितने months हो गए? 4 5 are 20, 4 6 are 24, nearly 6 months. So you have heard, no, in government jobs 6 months free maternity leave is given. So wages will not be reduced. 100% wages will be given. Hana. What about miscarriage? She got abortion. She is not having successful delivery. In case of abortion, also 6 weeks, 100% wages are given. And during the entire pregnancy, if she falls sick, Hana, extra 4 weeks will be given for that. So that is the maternity benefit. The summary is in front of you. I got it. 100% full medical care. Okay. You can see 100% benefit is given only in 2 cases. What are the 2 cases 100% के लिए? एक तो enhanced sickness benefit, that is vasectomy, tubectomy में, और maternity में 100% दिया जाता है. 90% is given in temporary disablement, permanent disablement and dependent. इन तीनों को 90% दिया जाता है as a pension throughout. है ना? Sickness benefit, extended sickness is 80% up to 2 years. है ना? That is 730 days for 34 diseases. Sickness benefits 70% up to 91 days. और funeral is cash. है ना? अब शायद modification हो गया है 10,000 की जगह 15,000 है. I will check and confirm whether it is 10,000 or 15,000. A cash benefit of the funeral. Say yes. Learn the percentage, learn the days. ESI is done. We are done with Factory Act. We are done with ESI. People respond. People respond. Students respond. Say something. You got? So I taught you the guidelines of the Factory Act. I taught you the guidelines of the this thing. ESI, and you get many questions on that. Can we do the questions? Don't try to mug it up. You have understood, it's more than sufficient. Okay, you can easily pick it up in the options. Just understand, keep on understanding the thing. Don't mug up anything. So read the question and tell me the answer. I guess answer is already there. Indian Constitution has declared that children under what years of age should not be employed in any factory. You should not give employment to any child who is less than what years of age? 14 years. So we all know the answer is 14 years. Okay. The next question. The next question is in front of you. Safety officer is appointed over how many workers? Over how many workers there should be one safety officer? I told you 500 worker, 1,000 worker, 2,000 worker or 5,000 worker. Can you please try? Tell me the answer. Yes, so over every 1,000 worker, there is one safety officer. If I change the question from to safety officer to welfare officer, what is your answer then? Welfare officer. Welfare officer is over every 5,000, 500. In that case, answer will become 500. Okay. So let's move ahead. Yes. Under ESI Act, sickness benefit is given for how many days? 17 days, 39 days, 91 days, 117 days. Simple sickness benefit, not extended, not enhanced. Simple sickness benefit. I'm asking, yes, it's for 91 days. 91 days, 70% of the wages will be given. If I say instead of sickness, extended sickness, so it will become 2 years and 80% of the wages. Got it? Hannah? So there are 3 sickness benefit. I enumerate again. Simple sickness, extended sickness, enhanced sickness. Okay, tell me the duration. This is for 91 days. This is 2 year. This is either 14 day or 7 day. Hana, tell me the percentage. Hana, percentage. Here percentage is 70%, here 80%, and here 100%. This is tubectomy, this is vasectomy. I guess I'm right. Hana, so they are asking for sickness. Go with 91. Okay. The next question. What are the maximum permissible working hours? Hana, work person per week. According to the Factory Act. Per week, how many hours the person can work? 48 hours, 42 hours, 48 hours, 56 hours, or 60 hours? How many hours a person can work according to Factory Act? Maximum. I have not mentioned overpay. I'm asking normally only. Normally. So correct answer is 48 hours. You all are right. But if I include the word overpay, more than 48 hours, if you are asking someone to work for you, the person have a right to ask for the overpay. The person can work up to 60 hours, है ना? लेकिन you should give extra 12 hours payment. 12 hours का payment extra you have to give. You cannot give the payment, same payment, and you can ask to work more. The person can complain for your factory and your factory can seal, है ना? So don't take a chance if someone is having a factory. So these are the rules which are made for the occupational health, है ना? So there are certain legislation and guidelines. Okay, so yes. So let's come on the next chapter, genetics and health. Very small chapter. Anna, so till now we have completed 3 out of 7. This is the 4th out of 7. We are starting genetics and health. It's very small. In 10-15 minutes we can complete. Can I start? How many of you with me? You all are live? Alive? Can we start genetics and health? Let's start genetics. So you all know what is a genome, what is genomics, what is gene therapy. Don't go. Yeah. There are 2 types of genetics, preventive measures for genetic disorders. Hana? So there are genetic disorders, the disorders pass from generation to generation. Genetic disorders are the disorders which pass from generation to generation. If the parent, any of the parent have any disease, the progeny will also have the same disease. That is, it is passed in the generation. The offspring will also have the same disease. There are 2 types of preventive measures we can take for genetic disorders, eugenics and euthygenic. See the difference in the spelling. This is eugenics and this is euthenics. Eugenics and euthenics. What's the difference between them? You want to prevent genetic disorder. I do not want anyone should have genetic disorder. So let's start with eugenics. What is eugenics? Eugenics term is given by Sir Francis Galton. First, it is a genetic manipulation. It is a genetic manipulation. How we do the genetic manipulation? Hana, so let me tell you. There are 2 types. You can improve the genetically endowment of the human population or decrease the diseases. Let me tell you. There are 2 types of eugenics, negative and positive. Imagine someone is having a very desirable genotype. Now everyone wants they should have a children which are beautiful looking, they should be intelligent, they should be smart, they should be lean, they should be thin, they should be tall. Everyone wants a child looking like that, Hannah. But the child looks like parents only. Of course, Hannah, you got my point. Imagine there is a couple, the husband, wife, both have favorable genotype. Hannah, both of them are high IQ, both of them are educated, both of them are good looking, and they don't have any disease. So this is the desirable genotype. So we will compel them. We will give them the burden of the parenthood so that they should reproduce more. So all the progeny will be like that only. And imagine there is a couple in which they already have the disease. They are weak, they have low IQ, they don't have favorable conditions in them. So they are genetically weak or defective. So we can compulsion them that they should not reproduce. Sterilization, debearing from the children, it cannot be done officially. We cannot do that. Just for theory purpose, understand the meaning. So this is known as eugenics. So I am doing manipulation at the genetic level. So the one who is having favorable gene, I'm giving them burden to reproduce. The one who is having unfavorable genes, I am stopping them to reproduce. Hana, it's like the Hitler. Have you heard about the Hitler, the Germany story? Hitler used to kill the weak people. Hana, that Hitler was doing negative eugenics. So he do not want that in entire country, no one should be weak. So whosoever is weak in his country, and he kills that. So he was practicing negative eugenics. He killed that person. You got my point? That is the Hitler that he was doing, but currently no one can do that. Okay. So negative eugenics, positive eugenics. Kill the weak and promote the stronger one. So that is genetic manipulation. That is known as eugenics. genetic manipulation. We are manipulating the genes. Okay, Sir Francis Galton has given this term. Okay, so negative eugenics can be done by abortion, sterilization, other methods of family planning, lower the fertility of the people who are genetically disadvantaged. And positive eugenics encourage the reproduction in the people who are genetically very improved, है ना? So give them financial help, give them political help, है ना? Target such population, take the ova and sperm of such population and do in vitro fertilization, do egg transfer, you can do the surrogacy or gene cloning. All these possibilities are there. How many of you got it? This is eugenics. What are euthygenic? No, I will not manipulate the genes, I will manipulate the environment. I will manipulate the environment, है ना? Because there is a mutual interaction between the genes and environment is important. So I'm not manipulating the genes, I'm manipulating the environment now. So in euthygenics, the environment is changed. So it deals with the human improvement through external environment. We will give favorable environment, okay? So that the person overall genetically will become good and the genetic disease will be less. Got it? Got it? Can we go ahead? So tell me the meaning of euthygenics and eugenics. Here it's environmental manipulation, here it's genetic manipulation. Say yes. Got it? So that's what you have to learn. Both can be negative, both can be positive. This negative positive I've explained you. Here negative euthygenics is pollution, overcrowding, lack of education is negative one. These all are environmental factors that causes the disease. Positive euthygenics is vaccination. I can vaccinate the children, so they will not have the disease. It's an environmental manipulation. And genetic engineering we can do. So like that. So how many of you got it? So learn the two terms. Eugenics, eugenics, and euthenics. Eugenics is genes, manipulating genes. And euthenics is manipulating the environment. That's it. You have to learn the two terms. Bas khatam. Learn that. Question will come on that only. Okay. Now tell me the ways to reduce genetic disorders. There are 6 ways, 4 or 5 ways we will discuss. The first is the genetic counseling. Do the genetic counseling. Process of offering the counseling to improve the genetically constitution at individual or family level. So don't learn the definition. That will be too complicated for you. So what you can do the genetic counseling of a couple who are about to reproduce. The newly married couple, they are about to reproduce, or before marriage, you can do the genetic counseling. Erythroblastosis fetalis, a negative female should not marry a positive male. I'm talking about blood group. A negative, B negative, AB negative, O negative female should not marry a positive male. If they are doing so, you should stop them. Still they want to do so, so during pregnancy they should be beware. They should take the treatment or prevention of erythroblastosis fetalis. So you are preventing some diseases. This is how you can do the genetic counseling. So there is tooth Thel minor or any autosomal recessive disease should not marry. 1/4 of the chance that the child will be Thel major. 1/4 of the chance. So this is genetic counseling. So before marriage, check the genotype of both the partners and tell them all the possibilities their offspring can have based on their diseases. They have some autosomal dominant, autosomal recessive disease. This is how you can help them. This is genetic counseling. Okay, number 1. Okay, number 2, contagious, consanguineous or late marriages should be avoided. What is consanguineous marriages? The marriages in closed group, the close relatives or closed groups. So it should be avoided. It should be avoided because in the same family, the 2 person can have the same disorders. Like Thel minor, the same example. It's very common in Punjabis. It's very common in Gujaratis. It's very common in Sindhis. So if they marry among themselves, there are high possibilities that 2 Thel minor will marry together. So intercaste marriages are promoted here. So the people should not marry in the same relatives. In some cultures, the cousins marry with each other. So that should not. They belong to the same genotype. Ultimately, their ancestors are same. So they should not marry. They have the same genes. Sometimes they have the same disease. It's minor, it's not presenting. But when they will fertilize, the children, offspring of them can have the major disease like Thel minor. The 2 autosomal recessive can present. These are the carriers and they can have the offspring as the cases. So that's why these marriages should be avoided. You should counsel them. Late marriages should be avoided. Late marriages for female. Any female who is more than 35 years of age should not reproduce. The female should reproduce before that. Because after 35 years of age, there are many changes which take place in the ova and the offspring can have the Down syndrome, other disorders. So that's what they are also avoided. So reason is different. Okay. The next is specific protection. any pregnant female, X-ray exposure should not be there. So on all the X-rays, CT scan in the hospitals, it's written in big way. If you are pregnant, don't enter. Don't enter. If you're not sure that whether you are pregnant or not pregnant, then also don't enter. है ना? So the X-ray exposure is avoided. है ना? And all the radiologists also, they should wear a lead apron before they enter the X-ray room, or they should enter the CT room. Okay, it should be covered. Okay, specific protection. Or the screening can be done. Neonatal screening we do nowadays. It's of choice. It's voluntary. I mean, if someone can afford, today a newborn is born, so we offer a list of all the genetic disorders that we can carry out in the umbilical sample blood. है ना? So at the birth only we come to know a list of set of disorder. Neonatal screening we do. है ना? Amniocentesis we can do. You know what is amniocentesis? We aspirate the amniotic fluid by doing guided sonography. And in that we can test. So before the fetus is born, we come to know what all diseases the fetus is having. For example, there is a Thel minor mother, Thel minor father. They married together. Now they know both of them are Thel minor. Now the female got pregnant and she want to test whether my child is Thel major or not. So if the child is Thel minor, I mean the fetus is Thel major, we can do the abortion. There is no use of giving birth to such baby. No, it's the choice of the parents, I mean. है ना? Or if the child is having Down syndrome, so there is no use of taking the birth of this child. So the abortions are possible at that stage. Okay, so amniocentesis is possible. Okay, indication when the mother is more than 35 years of age and in the family there is a Down syndrome history. So amniocentesis should be done. The patient who already have a child, who is having Down syndrome, and now the female is pregnant again, है ना? There is one of the parent have chromosomal translocation, one of the parent have some metabolic defect, or sex determination is warranted. Although sex determination of the fetus before birth is a crime because of female feticide, है ना? But there are certain disorders which are common only in male child. There are certain disorders which are common in female child, in which with special permission from the court, the sex determination of the fetus is done. Normally it's a crime, mind my words, normally it's a crime, but with special permission in some genetic disorders where it is warranted, knowing the sex of the baby is warranted, because there are some disorders which are common in male and female based on that. Hannah, there is a list of disorders, so this can be done. Okay, so for that also amniocentesis we will do. Say yes, say no, say something. So this is amniocentesis. Okay, so this is all thing. Now lastly in the genetics, ek last cheez bataungi, then this chapter is also done. Genetic inheritance. There are 4 types of genetic inheritance: autosomal dominant, autosomal recessive, X-linked dominant, and X-linked recessive. Now, this is a topic from the pathology, or I don't know, but here I will give you the list of these disorders. You usually get a question that neurofibromatosis is which type? Marfan syndrome is which type? And Duchenne dystrophy is of which type? Color blindness is so tell me the trait, the inheritance in many disorders. So I am going to give you 4 mnemonics. I'm going to give you 4 mnemonics for each of them. Learn the list of the diseases. Let's start with autosomal dominant. It's a big list. I'm having a mnemonic. The mnemonic is वो, familial hypercholesteremia, autosomal dominant है. The main mnemonic is dominant. वो stands for von Willebrand disease. Familial stands for familial adenomatous polyposis, that is FAP. है ना? Hypercholesteremia is hypercholesteremia. Autosomal is adult polycystic kidney disease. Dominant, DOMINANT. D stands for dystrophy myotonica. O stands for osteogenesis imperfecta. M stands for Marfan. I stands for intermittent porphyria. There are 2 N, neurofibromatosis 1, neurofibromatosis 2. A stands for achondroplasia. Okay. And T stands for tuberous sclerosis. And H stands for Huntington also. And hereditary spherocytosis also. In sab pe question hai, maximum of them have PYQ. You already have PYQ in your exam, especially on the Marfan, on neurofibromatosis, on tuberous sclerosis, on Huntington or hereditary spherocytosis. Osteogenesis imperfecta also. These all are your PYQs. They will ask you what is the inheritance they follow, these diseases. So you have to learn the mnemonic. Can we say it once? वो, familial, hypercholesteremia, autosomal, dominant है. Say the full form. First, try to write it down correctly. Von Willebrand disease. Okay. Familial adenomatous polyposis. Okay. What is H? Hypercholesteremia. Hypercholesteremia is hypercholesteremia. This is adult polycystic kidney disease. है ना? This is dystrophic myotonica. Osteogenesis imperfecta. Marfan. है ना? What was I forgot. Intermittent porphyria. Okay, there are 2N. Neurofibromatosis 1 and 2. Achondroplasia, tuberous sclerosis, and there are 2H, Hutchinson and hereditary spherocytosis. So if you know the mnemonic, you can try in the exam. If you don't know the mnemonic, forget it. You are losing that question. So at least try with the mnemonic. Coming on the second one, we are done with autosomal dominant. Come on, autosomal recessive. I'm again having a mnemonic. The mnemonic is ABCD, EFGH, SPW, है ना? SPW और PSW. PSM होता है ना? PSM को PSW बना दो, है ना? PSW. You can learn like that, है ना? So ABCD, EFGH, PSW, SPW, whatever. A stands for albinism and alpha-1 antitrypsin deficiency. Two things are there. B stands for बीटा थैलेसीमिया. ठीक है, बीटा थैलेसीमिया से ही मुझे सिकल सेल एनीमिया भी याद आ जाता है. बोथ आर एनीमियास. बीटा थैलेसीमिया, सिकल सेल एनीमिया, both are autosomal recessive. Okay, but hereditary spherocytosis was autosomal dominant. Please see. C stands for cystic fibrosis. D stands for deafness, sensory neural deafness, and Dubin-Johnson. E stands for enzyme deficiency. Which enzyme? Glycogen storage, lysosomal, all enzyme deficiency. F stands for two things: Fanconi anemia, Friedreich ataxia. G stands for galactosemia. There are 2H, hemochromatosis, Hurler. S is sickle cell, P is phenylketonuria, and W is Wilson. Wilson पे भी बहुत बार क्वेश्चन आया है. Say बोलने से होगा, लिखने देखने से नहीं होगा. Say it. What is the mnemonic? A B C D E F G H S P W. Say. A क्या है? Albinism and alpha-1 antitrypsin deficiency. Two things are there. B is beta thalassemia. वहीं से मुझे याद आ जाएगा sickle cell anemia. ठीक है? C is cystic fibrosis. D मतलब deafness. Which deafness? Sensory neural. E से enzyme. कौन से enzyme? Glycogen, lysosomal, all enzyme deficiency. F से दो चीजें हैं. Fanconi, Friedreich's. Fanconi anemia, Friedreich ataxia. G से galactosemia. H से hemochromatosis. One more thing is there, na H? I'm forgetting. P is phenylketonuria and W is Wilson. Okay. H से hemochromatosis and Hurler. Yes. So how many of you are with me? Okay. Forgive me for these, but yeah, I have to give these mnemonic. यहाँ पे नहीं भी करोगे तो पैथो में करना ही करना है. So here you skip now. You have to do it in patho. Otherwise, do it here only. Okay. So the third is X-linked dominant. We are done with autosomal dominant. We are done with autosomal recessive. Autosomal dominant is done. Autosomal recessive is done. Now X-linked dominant and X-linked recessive. So X-linked dominant. X-linked dominant, only 4 diseases are there. The mnemonic is FAIR. F stands for facio-oral syndrome. A for Alport. Alport पे बहुत question आता है. Repeated question. Learn it. I is incontinenta pigmentosa. And R is rickets, resistant rickets. Mainly इसमें से सिर्फ Alport पे question आता है. If you want to learn, it's good. All of them. If you don't want to learn all, learn Alport. X-linked dominant में एक ही पे question आता है. Alport. Please learn that. And last is X-linked recessive. The last. Okay. The mnemonic is Graham Bell. Grahambell. Graham Bell. G stands for G6PD deficiency, repeated question. R stands for retinitis pigmentosa. A stands for androgen insensitivity. H for hemophilia, repeated question. है ना? A for adenoleukodystrophy. M for Manke. B for Becher and Duchenne dystrophy and color blindness. B for blindness. इस पे भी P last to last year FMG का question है. Color blindness is X-linked recessive. Color blindness पे question था. Okay. E for Emery-Dufros dystrophy. L for Lish-Nyhan syndrome. One more L for Lowe syndrome. Anna, I know it's difficult. I know. I agree. But at least try. At least try. If you try, it will be done. You don't have to write it in your exam. You have to identify from 4 options. If you know the mnemonic, not the full form, still you can try. Anna, so try it out. Okay, you got my point. So at least you try to learn the mnemonic. What are the 4 mnemonics? Autosomal dominant, autosomal recessive, X-linked dominant, and X-linked recessive. We will try it once again. Okay, tell me the mnemonics. Autosomal dominant का everyone write down in the chat box. Mnemonic. Only mnemonic, not the full form. वो familial hypercholesteremia autosomal dominant है. Dominant. DOMINENT. Dominant है. Okay. Autosomal recessive. The mnemonic is A, B, C, D, E, F, G, H, S, P, W. Okay. X-linked dominant. FAIR. FAIR. The main is Alport. है ना? And last one, X-linked recessive, Graham Bell. Graham, Graham. BELL. Anna, so please learn, at least try. How many of you got it, or how many of you leave, or they are sleeping? You got it? Yes, very good, Sriniket, very good, very good. So try with the mnemonics, at least with the mnemonics. Now the 4 options are in front of you. You can rule out the option, you can rule in the option. But if you don't have the mnemonic, imagine if any of them is coming in your exam, you will get confused. You cannot answer without mnemonic. Got it? Everyone say yes. Very good, Aditi. Very good. Best. Very good. Very good. Everyone good. Okay. So can we proceed? Learn it. Learn it. You will get questions on that. Every year you get a question, FMG question. Okay. So that is the thing. Hardy Shul, or you can leave all this. So read the question. Tell me the answer. We are done with genetics. Congratulations. The 4th chapter also done. Okay. Read the question. Tell me the answer. Hemophilia is a genetic disorder. It is transmitted as what? Hemophilia. So where it was coming? X-linked dominant, Y-linked dominant, X-linked recessive, or autosomal recessive? Hemophilia कहाँ आ रहा था? हाँ? Let me help you in revision. Graham Bell का H जो है, that is hemophilia. Now tell me where it was coming. Now tell me where it was coming. I have given you the answer. It's X-linked recessive. Very good. The correct answer is C. So in this way you can try. In this way you can try. Anna? So you get many questions. I put only one question, but if you check this section in your PYQ now, so whether it is given in PSM or not, I don't know, but they are given in pathology. Pathology के genetics में भर के question है. I will keep on changing the disease, the answer will change. If I change the disease, है ना? If I change it to sickle cell anemia, answer will become D. If I change it to beta thalassemia, answer will become D. If I change it to Wilson, answer is D. If I change it to tuberous sclerosis, answer will be autosomal dominant, like that. These all are your PYQs. I have put only one question. I will not waste your time. Okay, you can solve it, I guess. The next question. Marriage between 2 heterozygous individuals for the same disorder is prevented by which counseling? Retrospective genetic counseling or prospective? What is retrospective and prospective? Prospective is before marriage. Hana? They have not conceived. Before that, the couple is coming to you and they are taking the counseling. Retrospective, they already conceived. They already have the children and now they want the counseling. Retrospective, ulta. So heterozygous individual means both of them are thal minor. Both are heterozygous. Both are carrier. Both are like this. AA. Hana? But this is defective A. Hana? If they marry together, the child will be major. So we want a prospective. Hana? Prospective counseling. Retrospective means once the female will conceive, pregnancies occur, we cannot change it. Okay, so that is the thing. Effect of environment on genes is known as. Is it positive eugenics, negative eugenics, euthenics, or ergonomics? What I am asking? Effect of environment on the genes, not effect of genes on environment. So what is the correct answer? Environment is known as euthenics. I told you very clearly. So correct answer here is C. Hana? Correct answer is C. And if I change the question, effect of genes on environment, answer will become eugenics. In that case, answer will become eugenics. If I further change the question, fitting the person in the right job, fitting the right person to right job, answer will become ergonomics. So the terms look similar, but question is different. Their meaning is different. How many of you got it? The next question. All of the following are autosomal dominant except. So tell me the mnemonic of autosomal dominant. Which of the following is not autosomal dominant? The mnemonic is WO, familial, hypercholesteremia, autosomal dominant. DOMINANT. Dominant hai. Now see, neurofibromatosis both are coming. N and N. Tuberous sclerosis, I guess it's also coming. T. And Marfan, I guess it's also coming here. But ataxia telangiectasia is not coming in this mnemonic. So my answer will be D. In this way, I can easily answer the question. Here A is there, but I guess A was adult polycystic kidney. It's not ataxia telangiectasia. So even if you don't learn the full form now, from the option, you can easily make it out. So I don't recommend you to do the rectification. Just read the list and go to the exam. And I have faith you will be able to do that. Okay, Ji. So till now we are done with 4 chapters. The 5th one is in front of you, the mental health. Very small chapter, the mental one. Hana? After that, there is a big chapter, social science. Hana? So let's finish mental also. Hardly any questions come from mental health. So can I start the 5th chapter, the mental health? Hana? After that, 2 more are there. Okay. So mental health. Let's start mental health. Okay. So mental health mein, what are the causes of mental disorders? Have you seen a mentally retarded person? So there can be organic cause Organic cause means something is wrong in the brain. There is an organic cause. The organic cause may be there is atherosclerosis in the brain, blood vessel, cerebral. There can be a cancer in the brain. There can be some metabolic disorders in the body. There can be endocrine disease or chronic disease like TB, epilepsy. So that is the organic. You get the cause. Hai. There can be hereditary cause of mentally retarded person. That is schizophrenia. And there can be socio-pathological cause. For example, worries, too much tension, too much anxiety, too much stress in life, too much tension, frustration, unhappy married life, broken homes, divorce, poverty, industrialization, urbanization, loneliness, isolation, cruelty, rejection, neglection. Nowadays, the people are getting fired from the job. There is recession. They feel depressed, like that. They all also lead to mental retardation. So these are socio-pathological causes. So there are 3 causes of mental retardation. Number 1, organic cause means there is some problem in the brain. There can be some tumor, there is some atherosclerosis, there is some obstruction, there is some problem. Hereditary, so there is no problem in the brain, but it is coming in the genes. And the parents have the schizophrenia, the parents are mentally retarded, so child is also mentally retarded. That is hereditary. And third, there is no organic cause. If you check the MRI and CT in the brain of these person, it's normal. Still, they behave like mentally retarded person. They are too tense. They are too worried. That can be the thing. So socio-pathological. So tell me the 3 causes of mental retardation. What are the 3 causes? Organic, hereditary, socio-pathological. Yes, Hannah. Okay, what is the situation in India? WHO, not in India, in the world. WHO analysis show a global point prevalence is 10% for the adult. Out of 100, 10 are mentally retarded. You see the percentage, oh my God, 10. 10 is a big percentage out of 100. So is it true? Yes, out of 10, 100, the 10 are mentally retarded. For adults, we are talking. Anna. So the most common cause of mental retardation is depression. Depression is very common. Many people don't know they are depressed, but they are actually depressed. And depression is a disease. It should be treated. It should be in attention, and it should be treated by the psychologist. Okay, so unipolar depression, depressive disorder is the most common cause of mental health. Okay, most common cause of the death, but depression do not cause death. Most common cause of the death is Alzheimer. Right, so that is the thing. Okay, so let's go ahead. Most common causes depression, I told you. After that, alcohol disorder, schizophrenia, bipolar disorder, Alzheimer, migraine, epilepsy. These are the causes. Most common is depression. That's it. Now this program I'm going to cover in the National Health Program. You can leave it here. Nothing important. So government has started a program for mentally retarded person. The name of the program is National Mental Health Program. National Mental Health Program. Nobody is going to ask you this program. It's not important. I know. It was established in 1982. And total 11 institutes are there for the training. The main aim of the program is prevention and treatment of mental disorders. Prevention and treatment of mental disorders. So that is the thing. That's it. Nothing important. Okay. Read the question, tell me the answer. Maximum loss of daily occurs by which psychiatric disorder? Schizophrenia. What is daily? I told you. Have you forgot? What is daily? Disability adjusted life year. How many years of the life are lost in premature death and how many years of the life are lost due to disability? The sum of the two is known as daily. I told you. So that is daily. How many years of the life are lost due to mental disorder? So schizophrenia, depression, alcohol or bipolar disorder. So correct answer is depression. Most common cause is depression. If someone is depressed, so I'm living for 60 years, just suppose 70 years, okay? So I do not want to live more than that. So if anyone is living 60, 70 years, out of which if someone is depressed for many years, so these are the life, the person is not healthy. So that should be deduced to calculate the Sullivan index. I told you what is Sullivan index. Sullivan index is life full of health. So from the total life expectancy, deduce the daily. So that is the daily. So depression is the most common psychiatric disorder which is contributing in the daily, you can say. Okay, which of the following is not a socio-pathological factor for mental illness? Mental illness, I told you 3 causes: organic, hereditary, and the third one were the socio-pathological, in which you will get nothing in the brain. Emotional stress is there or not there, frustration is there or not there, endocrine disease is there or not there, anxiety is there or not there. So which of the following is not a socio-pathological cause of depression? Yes, Sanya. Yes, Elizabeth, you all are right. Yes, Prabingul. Yes, here also Megha, Leah, you all are right. So yes, the correct answer here is endocrine, because endocrine is organic cause. not psycho. In endocrine, you will get something abnormal in the body. In the remaining three, you will not get any abnormality. Still, patient is mentally not healthy. Okay, so we are done with this also. Okay, the sixth chapter. Let's start social science. Now it is a big chapter, a little bit big. So let's take a small coffee break, and after that we will continue the social science followed by history. Two more chapters are there, sixth and seventh. So social science followed by history and followed by biostats. Anna, so this is the target for today. Let's take a small break. Okay, Ji, let's take a 15-minute break. Hannah, so it's 4:45. Let's meet again at 5 sharp. Okay, at 5. At 5, we will start till maybe 6:30. We will be packing today. Okay, done for the next 1.5 hour. So in the half hour, we are going to finish these two and 1 hour for biostats. Okay, we will at least start biostat. Half of the biostats will be done, not completely. Tomorrow, communicable, non-communicable, national health program. These are the big three things, and some small chapters are remaining. We will do the wrap up. Okay, so tomorrow I can extend the class if it is not completed, but I will finish it everything. Don't worry. Okay, so let's meet at 5 o'clock. Hello everyone, am I back? Can you see? Can you hear? Can we continue? The last one for today. Anyone please respond? Elizabeth, Sriniket, Amu, Aditi, Nidhi, anyone? Please respond, people. Can we continue with the social science? Okay, thank you. Thank you. Got it. Got it. So let's continue with social science. Okay, do you know the difference between society and community? They are not synonyms. So what is the difference between society and community? Community is a group of people. Community. It's a group of people which is bounded by geographical limitations. They have geographical boundary. Like the India. India is a community. It's a community. है ना? So we all are bounded. Like the states we say, I belong to Madhya Pradesh. So it's a community. So they are bounded by geographical boundaries and they all have common interest. So that is the community. है ना? What is a society? Society is a again group of individual. It's a body of individual, group of individual. They live together within same social norms. They are not bounded by geographical limitations. They have same social norms. The social norms are same. That is the society. Now it's like the chapter social science is little bit of philosophy only. So please just understand. The society is the group of people with same social norm, and the community is a group of people with same geographical boundaries. Understand? Now what is the culture? What do you mean by culture? कहते हैं ना, this is my culture, this is my family's culture. What do you mean by culture? It's a learned behavior. It's not inherited. You have to learn it after your birth. So it's a learned behavior which is socially acquired. It is socially accepted, and you are learning that behavior. What is required in the social life, society. So that is a learned behavior that establish the pattern of behavior, which is considered as normal for the society. So what is considered as normal for the society? You are learning that behavior. That is the culture. So that is the culture. Mixing of two cultures together is known as acculturation. It's an MCQ. What is acculturation? Mixing of two cultures together. Maybe due to the two marriages, the two intercaste marriages, the people are coming with two different cultures and they are mixing it. Maybe due to trade, due to commerce, due to industrialization, due to propagation of the religion, due to education, due to conquest, the two cultures can be mixed together. That is known as acculturation. Now there are certain theories in sociology. Let me explain you those theories. Can I start the theories? There are four theories. Marxist theory, Parsonian theory, Foucauldian theory, and feminist theory. The Marxian theory is written wrong here. I guess you should cancel it. You should cancel it and you should say it keeping money ahead of health. Some people are working too much. They are very professionalism. They are not taking care of their health. They are not taking good diet, good rest, good nutrition. They are just working. They are keeping money ahead of health. So because the diseases occur because people keep money ahead of their health. They think money is more important as their health. So that is known as Marxist theory. Please, you can correct it. Here it is a typing mistake, I guess. The second is Parsonian theory. Parsonian theory says that we divide the complete population into two groups, disease, non-disease. So Parsonian theory says that the cause of the disease is the social strain. Because of the social strain, many diseases are there because of the demands of the society. That is the Parsonian. Foucauldian theory says that we divide the population into two groups, diseased and non-diseased. So it's a way to segregate the population. And feminist theory says that this is a world, this is a population which is patriarchal. Patriarchal society means man-oriented society, in which after the marriage, the female leave the home, not the man. So the society is patriarchal. That's why diseases are more in female as compared to males. These all are theories. Nothing is proven. These all are theories. You have to learn the meaning of them. That's it. So can you tell me one word to learn? Can you tell me one word in each of the theory? What is Marxist theory? Keeping money ahead of health. What is Parsonian theory? The cause of the disease is the social strain, the demand of the society, social role. Okay. Foucauldian theory, diseases are segregating the population into two groups, diseased and non-diseased. And feminist theory, the patriarchal society. How many of you got it? Learn the one word. That's it. You will just get a questions on that and you have to pick it up which theory. Name of the person and name of the theory and the meaning of that. That's it. Now I'm going to teach you the meaning of the fourth thing. Do you know what is the difference between opinion? What is the difference between belief, attitude, and habit? This is my opinion. This is my belief. This is my attitude, and this is my habit. So there is a difference between all four. I will try to explain. Hannah, okay, please concentrate. What are opinion? Opinion is temporary and it's subjective feeling. It's very subjective. It's temporary. It's subjective in nature. What are opinion? These are the views held by the people on a point of dispute. For example, let me take any topic. For example, let's take a political topic. So if I ask this government is good or bad, so maybe your opinion is something else, my opinion is something else. So there is a point of dispute in which we are arguing with each other. I mean, we are disputing with each other and arguing with each other. We are debating with each other. Okay. So your views can be different, my views can be different, but that's temporary. For example, I'm able to convince you, no, you are wrong. See, this is the fact, this is the fact, this is the fact, this is the fact. You are wrong. At the end, you can change your opinion because they are temporary and they are very subjective. It is easily changeable. So we can change people's opinion by providing facts to them, by convincing them. Opinions are temporary and they are subjective. They are subjective. Second, come on the belief. Belief are permanent. They are also subjective, but they are permanent. They are unshakable. So beliefs are derived from the parents and grandparents and other people we respect. So I believe that means my the family taught me this, and my family cannot be wrong. My parents cannot be wrong. So it is the belief. These are also views. ये भी views हैं. A person have views from inside. These are also views. But these are not the views given by the person we respect. These are not the views of those, so they can be easily changed. If you have an opinion on something, if I convince you, you can change your opinion, but I don't think I can change your belief. If something your parents, grandparents, and other people you respect taught you, explained you, you believe that this is right, that will your permanent belief, that is unchanging, unshakable. It is not based on evidence. Even I produce many facts. See, this is wrong, this is wrong. Still you say, maybe I'm wrong, but my family believes so, so it is only right for me. So that is the belief. That is subjective but unchangeable. It's permanent. The third is the attitude. What is attitude? Let me come. Again, the attitude is permanent. But it's objective. It's not subjective. These two are subjective. This one is objective. It's caught. It's not taught. No one teach you your attitude. You catch it from your environment, from your genes and from your environment. Two things decide your attitude. What is your attitude? So it is caught. It is not taught. No one can teach you what should be your attitude. It's objective in nature. It's not subjective, and it's permanent. It's permanent. It is an expression of an individual degree of like and dislike. What you like, what you dislike, you will catch it. It is not taught. It is not taught. It is not influenced by motivation. How much I motivate you, you should change your attitude. You will not be able to do so. It's permanent. And lastly, habit. Habit or practice is one and the same thing. Something we are doing in repetition, that comes in our habit. Habit is an accustomed way of doing a thing. If you do anything repeatedly, you will get accustomed with that. That you will say it is a habit, and that can be influenced by motivation. If I motivate you that before eating you should wash your hand, it's a good habit. So if I constantly say this and you constantly do that, one day without saying, you will definitely do that. You will become accustomed with that. That is the habit. How many of you don't got it? So tell me, what is opinion and belief? Opinion and belief both are subjective views. Subject to subject, they vary. And this is temporary, this is permanent. I mean, opinion is temporary, belief is permanent. People react. Anna, please react. It's a boring topic, but still I'm making it interesting. Say, attitude, it's permanent. But this is objective, not subjective. And what are habits? Accustomed way of doing a thing. The attitude is caught, it's not taught. See, got it, everyone. So please understand the meaning of all four. Okay. What is learning? Learning is any relative permanent change in the behavior that occurs as a result of practice or experience. It's a continuous process. Whether conscious or unconscious, we are learning as something. Whether conscious, sometimes we consciously learning, like consciously you are listening my lecture right now. It's a conscious learning. Sometimes unconscious also, we do learning. So learning depends on 5 factors. Number 1, the intelligence. What is your intelligence? That depends how fast you are doing the learning. Number 2, your age. Number 3, learning situation. The situation is ideal, the educator is good, and everything is good. Motivation and physical health. You are healthy, then only you can learn. If you are sick, you are ill, you cannot learn. So these are the 5 factors on which learning depends. There are 3 types of learning. Cognitive learning based on knowledge. Currently, you are taking cognitive learning. I'm keeping on giving you knowledge. So you are doing cognitive learning. Affective learning is based on attitude. It is associated with attitude. And psychomotor learning is based on skill. If I teach you how to cycle kaise chalana hai na, how to drive a car, so that is not based on knowledge. That is based on skill. So skill based learning is psychomotor learning. Got it? So there are 3 types of learning. The most important topic on which maximum MCQs come is IQ. What is IQ? What is your IQ, by the way? What is IQ? Say the full form of IQ. IQ is intelligence coefficient. What is IQ? Intelligence quotient. Okay, IQ is discovered first time by the person Binet and Simon. Binet and Simon have first time discovered the test for IQ. And the name of the test is Stern IQ test. Stern IQ test. What is IQ? This is the formula of IQ. See, IQ is mental age upon chronological age into 100. Okay, listen. What is your chronological age? Your actual age. Hana, how many years you are? Maybe 20, 23, 25, 30, whatever. Hana, so whatever is my age, that is my chronological age. But it is not necessary my mental age correspond that. My mental age can be equal to that, then IQ will become 100. They cancel each out. Hana, it can be ahead of that and it can be behind that. So it is not necessary the mental age correspond the chronological age. Chronological age is fixed. That is our actual age in years. Hana, from our birthday till date. That is our actual age, is our chronological age. So chronological age is the denominator. Mental age can be different. You may have seen some small kids and they learn very fast and their IQ is more. So mental age can be ahead of the age, mental age can be behind the age, and mental age can correspond also. So there are three possibilities. Got it? That is IQ. Everyone knows their chronological age, but how many of you know your mental age? What is your mental age? You cannot know your mental age. You have to perform a test. The psychiatrist will perform the test, and the name of the test is Stern test. Stern test. So based on that, the psychiatrist will allot, based on your chronological age, your mental age is ahead or behind. So that will be given. So we have to perform a test. Now based on IQ, this is the IQ range and this is the level of intelligence. See, normal. What is normal? Normal is both are same. They cancel each out. Answer is 100. So 10 above that and 10 below that. 90 to 110 is normal. Anna, 90. If both of them are equal, they will cancel. Mental age or chronological age will cancel each other. So answer is 100. 10 below that, 10 above that. I mean to say 90. I'm sorry. 90 to 110 is normal. Say yes. Say yes. 90. Now usse niche ke dekho. Start. If someone is having IQ 1/4 of the chronological age, 25, 1/4. Just suppose my age is 40, but my mind is like 10-year child. So, so mental age is 10 year, but my actual age is 40 year. So it is 25. So 0 to 25 is idiot. So that person is called as idiot. Don't call anyone as idiot. If the mental age is 1/4 of the chronological age, then only the person is idiot. Okay, it's 0 to 25. Okay, 25 to 50. If someone is having half of the mental age, my age is 40, but my mental age is 20. So call that person as imbecile. Imbecile is a person whose mental age is half of the chronological age. Here it's 1/4, here it's half. Don't learn 1/4 and half. Learn 0 to 25, 25 to 50. Now 50 to 70 is moron. 70 to 80 is borderline IQ. 80 to 90 is low normal. And this is normal. This is normal. Normal is 90 to 110. 110 to 120 is person is having superior IQ. 120 to 140, person is having very superior IQ. And 140 and above, person is near genius. There is no genius in this world. The maximum person can be near genius. There is no genius. So this is the thing. So learn it, learn it, learn it. How you will learn? How I learn? Let me tell you. I start from normal. I write normal and I know what is normal. I start with normal as 90 to 110 because I know 100 is normal. 10 below that, 10 above that. Okay, I start like this. Now I will start writing from the beginning. 0 to 25, 25 to 50, 50 to 70, 70 to 80, and 80 to 90. These are 5 above that, 5 categories. There are 5 categories above that. And there are superior, very superior, 3 categories below that. 90 to 110. Now say the categories below that. 110 to 120. 120 to 130. 130 to 140. And more than 140. More than. So 4 categories below that. Let me tell the names. So this one is known as idiot. Idiot. This one is known as imbecile. ठीक है? This one is known as moron. ठीक है? This one is borderline. Borderline. है ना? This one is low normal. Normal से पहले क्या आता है? Low normal. ठीक है? So above are done. Now come below. Come below. So this is normal. अब उसके ऊपर कोई है तो it's superior. It's very superior. I'm just getting confused. This one is near genius. What is this? Is there a category? I think it's 120 to 140 only. There is no further category. 120 to 140 is very superior. We are having 3 categories. Yes, I'm right. 120 to 140 directly. Okay, how many of you got it? You want me to write again or you got it? Please learn it. You get questions on that. You want me to write again? Reply. Elizabeth, Sania, Shri Niket, Leah, others, say something. You want me to write again? You want to learn it or you got it? This is IQ scale. Learn the formula of IQ. IQ is equal to mental age upon chronological age into 100. If both of them are equal, answer is 100. Answer is 100. 100 is normal. 10 below, 10 above. 90 to 110 is normal. And if you follow this rule, you will easily make it out in the exam. So this is IQ. Never forget, you get questions on that. Now come on, mental retardation. To whom shall I call mental retardation? Ideally, what is normal IQ? I told you 90 to 110. I told you 90 to 110 is normal ना. Up to 70 also हम काम चला लेंगे. 70 से नीचे नहीं चलेगा. 70 is the cutoff for mental retardation. 70 and above I will consider normal. Although normal का definition I know, normal is 90 to 100, but for mental retardation 90 is not normal. For saying someone mental retardation, borderline also चलेगा. 70 is borderline ना. Borderline को हम mental retardation नहीं बोलेंगे. Below everything that, below 70 is mentally retarded. So come on the classification, 20 or below, less than 20. Less than 20 is severe mental retarded person. 20 to 35 is severe. This one is profound, I'm sorry. Profound mentally retarded. 20 to 35 is severe mentally retarded. 35 to 50 is moderate mentally retarded. And 50 to 70 is mild mentally retarded. So up 70 and above is normal. For mental retardation, 90 is not normal. You say 70 is normal. I will not call the person as mentally retarded. Below everything that is mentally retarded. So I will start from the bottom. I always start from the bottom. Like I start from 0 to 20, 20 to 35, 35 to 50, and 50 to 70. Above 70, it's normal. So say, this is profound mental retardation. Profound mental retardation. This is severe mental retardation. This is moderate. And this is mild mental retardation. How many of you got it? You get question on this. Last year FMG also have a question on that. Please learn the gradings, है ना? Please learn. अब सीधा लिखती हूँ एक बार. 0 to 20, 20 to 35, 35 to 50, 50 to 70. Learn the range. बस ये range learn कर लो. More than 70. Learn the range. Fast, fast, fast. So this is profound mental retardation. This is severe. This is moderate. And this is mild, and this is normal. Got it, everyone? Hana, this is mental retardation. So you have to learn two things. Number one, IQ. Number two, mental retardation. IQ also, I told you the scale. Start from normal. That is 90 to 110. And then start from the bottom. 0 to 25. 25 to 50. 50 to 70. Hana? No. 50 to 60. 60 to 70. And 70 to 90. Okay, these are the 1, 2, 3, 4, 5. Yes. So this is idiot, this is imbecile, this is moron, this is borderline, this is low normal. This one is normal. And above that, you already know. 90 to 110, 110 to 120, 120 to 140, more than 140. More than 140, near genius. This is superior, this is very superior. This is how you have to learn. Learn the range, you have to learn. The last thing here in this chapter is the family. And now what is a family? And now, you know, in the family, there are 6 phases. 6 phases. Let me tell you, it's very easy. First phase is family formation. Family formation starts with the marriage. And now the first phase, when two people are marrying together, they are starting their family. So when it starts, the beginning is the marriage. Till the first child, till the birth of the first child, they are in formation phase. Anna, so a couple got married, male, female, husband, wife, they got married. So they started the formation phase. And till they have their first child, they are still in their formation phase. From the first child till the last child, they can have multiple children, 1, 2, 3, 4, whatever. Till the last child, they are in extension phase. They are extending their family. They are extending. From the last child, last child se leke, first child leaves the home. Now, first child will become adult. He will also get married and he will leave the home with the wife and with the family. So it is complete extension. It is known as complete extension. Now, from first child leave the home, one by one, all the child will get married and they will also leave their home. They will become dependent one day, more than 18 years. They will keep on living. The daughters will get married. They will go their home. The sons get married. They will also separate and start their own family. We are talking about the Western culture. In India, the joint family is a culture here. Till last child leave the home, they are contraction. The family is contracting. First it was expansion and then contraction. The last child leave the home, one of the spouse die, of course. From the husband and wife, one of them will die, of course. So that is complete contraction. And finally, Finally, the first spouse dies se leke last spouse also dies. The second spouse, I mean, the survivor. So this is the complete family formed also, dissolution also. So complete family started and it dissolved. Say yes. So these are the 6 phases. Can you please enumerate the 6 phases? Can you please first read it? Formation. It's very easy. Let me help you. Formation, dissolution. है ना? Start with formation, complete with dissolution. उसके बाद extension, complete extension, contraction, complete contraction. Say what are the 6 phases in a family? Formation से start करो और finally dissolution पे खत्म कर दो. Dissolution. This is 1, this is 6. है ना? What is 2, 3, 4 and 5? Huh? What is that? Extension, complete extension, contraction, complete contraction, and finally dissolution. Say the beginning and the end point. Say the beginning point of all these, when this phase begin, and say the end point of all these, when it is ending. So formation start with marriage and till the first child born, first child. From the first child till last child born, it's extending. It's extending. The last child born से लेके first child leave the home. Leave the home. It's complete extension. Completely extended. Now, first child leave the home. से लेके last child leave the home. It's contraction. Last child leave the home से लेके one of the spouse dies. This is complete contraction. Or first spouse dies, second spouse also die. The complete family dissolution. This is how you have to learn. So basically, you have to see it's like this. You can see. So end of the first phase will be the beginning of the second phase, beginning of the next phase. That I mean. I guess you all got it. It's easy to go. So this is family. The 6 phases in a family, you should know. It's very easy. You get questions on that. You already know what is nuclear family. The husband and wife and their children. That's it. This is known as nuclear family. Elementary family, unitary family. Consists of a married couple and their children. Till the children become dependent. After that, the children will start leaving the parents. Nuclear family. Joint family, multiple couples live together. Multiple married couples along with their children. All the couples have their children. All the males are related by blood. They all are brothers. All the females are not blood relatives. They are the wives, they are the daughters, they are the sisters. You understand, in India it's very common. Property is common. There is a common pocket. And the senior male of the family is the authority. The senior male of the family, maybe the grandfather, maybe the most senior son, that is the head of the family. That will take all the common purse. Okay, so this is joint family. 3-generation family in which 3 generations remaining together. The grandparents, the parents, the children. We know 3-generation family. New family, any family which is formed within 10 years of duration. Communal family, when all the members are playing a part in its management. So it's not one head of the family. All the family members are given equal rights. That is communal family. Broken family, when parents are separated, divorced, or one of the parent is dead. And problem family, when the family lag behind of the community, they are very poor, like that. So please learn these. Now, what is your socio-economic scale? Do you belong to upper class, middle class, or lower class? Now there is a fashion upper middle class, lower class. Who decides the class? Who decides the class of a family? The class is of a family, not of a person. I cannot ask what is your class. I can ask what is your family's class. Does your family belong to upper class? Does your family belong to middle class? Or does your family belong to lower class? So for the class, we are having certain scales. I will teach you these scales. In the urban area, like in cities, we have modified Kuppuswamy scale, Kulshestra scale, Srivastav scale, and Jalota scale. I will teach you only one, Kuppuswamy. In the rural area, we have Udai Parik scale. Don't just see the name. Basically, one scale is important in your syllabus on which question come, Kuppuswamy scale. So we all belong to urban area. Most of the people belong to urban area. So in urban area, the class of the family decided by Kuppuswamy scale. So what is the class of the family? It depends, the socio-economic class I'm talking about. The class of the family, upper, middle, or lower. It depends on 3 factors. The complete income of the family, the education of the head of the family, and the occupation of the head of the family. Every family have a head. Usually the senior male is a head. But sometimes if male is dead, the father is not there, grandfather. So female can be the head of the family. So whosoever is the head of your family, you all can calculate your own class of your family based on the Kuppuswamy scale. Individually, you can calculate. It depends on 3 things. Learn education, occupation, income. EOI. Education of whom? Not the complete family education, only the head. Occupation of whom? Only the head of the family. and income of the complete family. But income सिर्फ complete family का है, but education occupation of the head of the family. So who is the head of your family now? Based on the education, there are 7 score. है ना? Based on the occupation, there are 10 score. And based on the income, there are 12 score. You have to pick it one. Now don't learn. You have to learn बस EOI. Question तो EOI पे ही आएगा. What are the 3 criteria in Kuppuswamy scale? Education, occupation, income, based on which we decide the class of the family. Whether the family belong to upper class, middle class, lower class. It depends on 3 things. Now here we are having 7 score, 10 score, 12 score. That's for your knowledge, I'm telling you, so that you can easily get it. That's for your knowledge. Don't learn it. Learn EOI. That's it. है ना? You yourself calculate the class of your family now with me. है ना? So see the education. Who's the head of your family? See the education of that person. Maybe the grandfather, maybe the father, someone may be the head of your family. No? So what is the education of that person? Is that person has done the PhD, that is professor of honors, PhD. So give the maximum score of your family. Your family have a 7 score in the education. If the head of the family is graduate or postgraduate, give score 6. Graduate, postgraduate together. है ना? Graduate or postgraduate, the score is 6. Is the head of the family is diploma pass? It's not graduate, it's diploma, or that's it. Diploma is 5. High school certificate yani up to class 12th, it's grade 4. Middle school means up to class 10th, it's grade 3. Up to class 5th, it's grade 2. And head of family is illiterate, not at all gone to the school once, so it is score 1. So give the score according to the education of the head of family. What is the education of head of family? Take 1. Take 1 of the score. Whatever you are picking, take 1. Okay, remember this. Now, what is the occupation of that person, head of the family? Is that person professor? The head of the family is always earning. The non-earning person cannot be the head of the family. Housewife cannot be the head of the family. The head of the family is the person who earns and who's the senior. Okay, so professor, is it a professional work? So give the score 10. Okay, semi-professional work, give the score 6. Clerical work, the businessman having a shop or a farmer, give score 5. A skilled worker, a skilled worker, give score 4. Semi-skilled worker, give score 3. Unskilled worker, give score 2. And unemployed, give score 1. So pick one of the score based on the occupation of head of family. Now, what is the income of your family? Now, every year these guidelines modify. Don't learn, just have a look. This is the monthly income of the entire family. So in which range? Entire family का income कौन सी range में आ रहा है? Pick one of the score from that. Pick one of. Now you add the 3 score. You add, है ना? So minimum maybe the worst to worst family. You will say, ma'am, here also I am 1. Here also I am 1. I'm sorry. Here I am 7. And I'm sorry, the score is 1. Here also the score is 1. And here also the minimum score is 1. The poor family, illiterate family, unemployed family. So minimum score is always 3. 1 plus 1 plus 1 minimum is family. And there is a best family in which the head of the family is a professor. The head of the family is highly qualified, PhD, and income is also very good. So maximum 10 plus 7 plus 12 is 29. I want you to learn the range. So minimum scoring is 3 and maximum is 29. It based on EOI. That's it. Question to इसी पे आएगा. Based on that, you do the sum. है ना? You do the sum. Maybe my family coming here. Maybe my family coming here. Maybe my family coming here. So I will add 10 plus 5 plus 6, whatever. So there may be some number, the addition of the 3. Now see, if it is less than 5, you belong to a lower family. I mean, the person belong to a lower family. If it is 5 to 10, the summation of the 3, it is known as upper lower. A little bit upper of the lower. You are not, I mean, the person is not belonging to lower class. It is little bit upper of the lower class. If it is 11 to 15, the person is belonging to lower middle. Middle में 2 middle hai. Lower middle, upper middle. And 15 to 25, it's upper middle. And more than 25 to 29, it's upper class. So say the range, say less than 5, 5 to 10, 10 to 15, 15 to 20 nahi hai, directly 25. And 25 to 29, because 29 is the maximum. Say the classes, you will say, ma'am, this is lower and this is upper. ठीक है? This is upper lower, a little bit upper of the lower, and these two are middle. These two are middle, upper middle and lower middle. How many of you got it? I tried my best to help you to learn it. So this is Kuppuswamy scale. Say yes. Say something. Say, respond, react. So this is Kuppuswamy. You got it? You want to say me again? So Kuppuswamy scale is for giving the socio-economic class to a family. Okay, it depends on three factors: education of the head of the family, occupation of the head of the family, and income of complete family. Not only head of the family, please mind, income of complete. If multiple members are earning, take complete income, monthly income. Okay, based on that, do the scoring. Minimum, so it depends on EOI. Minimum scoring is 3, 1, 1, 1. Minimum is 3. Maximum is 10, 7, and 12. It will be 29. Hai. So 3 to 29 is the range. So we will divide them like this: less than 5, 5 to 10, 10 to 15, 15 to 25, and 25 to 29. So this is lower class, this is upper class. Okay, and these two are middle class. Middle. This is lower middle, this is upper middle. Okay, this one is lower only, but a little bit upper lower. So that decides the class of that family. That family is high class, I mean upper class or low class or middle class, like that. Okay, Ji, how many of you got it? Read the question, tell me the answer. We are done with this chapter also. The last chapter now I will take, the history. Got it? Can I move ahead? Say something, respond. Just a second. Putting profit ahead of health, putting money ahead of health. This is a theory given by whom? Is it feminist? No, in the feminist it's a patriarchal society. Ye theory tha. Parsonian? No, Parsonian also it's not there. Foucauldian? No, it was dividing the disease into two category. Yes, Marxist. Marxist is the correct answer, and you all are right. The correct answer is Marxist. I have done the correction there also. So correct answer is C. The next question: when there is a contact between two people with different culture, they come together. So diffusion of the two culture takes place. What does it known as? Socialization, acculturation, adjustment, or all of the above? What do you call the mixing of two culture together? Two different people are coming together and mixing the cultures. What is this known as? I told you the term is acculturation, means mixing of two cultures. So questions are very simple. Don't try to mug it up. If you have understood, you will be right. The next question: tell me a temporary view which is held by the people on a point of debate. Temporary view. Is it opinion, practice, attitude, or belief? It is a temporary view. It's not permanent. It's a temporary view. So what is the correct answer? Is it opinion, practice, attitude, or belief? So opinions are temporary. Opinions are temporary. I told you that can be changed. If you have some opinion on some point, I can change it. If I present you fact, you can change. So on a movie, you say the movie was not good, ma'am. I say no, the movie was good. See the facts. The story is good. This is good. The songs is good. You will get, I also think now it was a good one. So this is the way. So with the help of the fact, I can change. Anyone can change each other's opinion. They are temporary and they are subjective. They are not objective. So correct answer is E. Okay. The next question: what is the learned behavior which is permanent and consistent but liable to change? A learned behavior which is permanent. Tell me a permanent learned behavior. Is it a cultural belief? Is it an attitude? Is it knowledge, or is it practice? I'm asking. A learned behavior which is permanent but liable to change. Although permanent but liable to change. So what is the correct answer? It's a belief. Belief. Beliefs are permanent. They are unshakable. You require a high degree of motivation to change it because they are acquired from the family members. So whether they are right or wrong, without basis on any fact, we just adopt them. So whether our parents taught us something right or wrong, since our parents are teaching us, we believe them, we respect them, and that will make our belief. So that is the thing. But they are liable to change. We can change them. Zyada mehnat lagegi, but change ho sakta hai. So correct answer is A. The next question: who is a Murun? The IQ of which is what? Is it 0 to 25, 25 to 50, 50 to 70, or 70 to 80? Who is a Murun? Moron, whatever you pronounce. Yes, who's the moron? Come on, based on the IQ. I told you the IQ scale. So correct answer is 25 to 50. You all are right. I'm sorry. Why you people are saying B? You have confused me also. The correct answer is C. 0 to 25 is idiot. 25 to 50 is imbecile. You forgot imbecile, I guess. And 50 to 70 is moron. 70 to 80 is borderline. Borderline. And 80 to 90 is low normal. And 90 to 110 is normal. How many of you realized your mistake? Correct answer is not B, it's C. If I change the question, answer will change. Filhal, moron ke liye answer is 50 to 70. Correct answer is C. If I change it to imbecile, answer will become B. If I change it to idiot, answer will become A. Say yes. You have to learn the scale. Don't get confused. You get many questions on IQ scale. The next question, what is the formula of IQ? IQ is calculated by which formula? Mental age upon chronological age into 100, mental minus chronological into 100, chronological upon mental into 100, or chronological minus mental into 100. Easy question. I guess easy question. Very easy question. You can respond. Yes. So of course, mental upon chronological. So mental age upon chronological age. Mental is the numerator. Chronological is denominator into 100. This is IQ. If both of them are equal, they will cancel. IQ is 100. That is normal. So correct answer is A. Hana, the next question. Calculate the IQ of a person. Hana, the chronological age is 10. Actually, the person is of 10 years, but mentally he is 4 years. So can you tell me in which category the person is coming? Can you please tell me in which category it is coming? Can you please calculate the IQ of this person for me? IQ is mental age upon chronological age into 100. So mental age is given to you 4 years, है ना? But actually the person is of 10 years. But उसका दिमाग अभी भी 4 साल जैसा है. बच्चा 10 साल का है. Into 100. Can you do the calculation? Answer is 40. The answer is, so 40 come in which range? Karthik. 40 come in which range? I told you the ranges, na? 0 to 25 is idiot. So it's not idiot. 25 to 50 की range में आ रहा है 40. 40 is coming in this range. So I will say it's imbecile. Yes. This is how questions are coming in your exam. Yes, yes. Sriniket, I know how to calculate. You tell me the answer. So 4 upon 10 into 100, answer is 40. We all know. 40 coming in which range? You have to see that. So you get many questions on IQ. IQ is a very important topic. You get many questions. Imbecile is the answer. Arrange the following stages of a family cycle in a sequence. You know the 6 stages of family cycle. I told you the first and the last to learn. Huh? So read the option. I'm not reading it. You just read it and tell me the answer. You know the first and the last. If you know that, you can arrange them, the 6 phases of a family cycle. Tell me the correct answer. Huh? Yes, you people are right. People started responding. The first is formation, the last is dissolution. So the first is formation, but last is not dissolution. Here formation, dissolution, formation, dissolution, formation, dissolution. उससे काम नहीं होगा. अब अंदर का देखो, है ना? So extension, complete extension, contraction, complete contraction. Extension, complete extension, contraction, complete contraction. Correct answer is D. I guess most of you are right. Some people are doing mistake, but most of you are right. Okay, so correct answer is D. You can make it out and you know the meaning of each of them. Anna, correct answer is D. Okay, what is a nuclear family? Husband, wife and son, husband, wife and dependent children, husband and wife only, or father, mother, husband, wife, all 4. You all can understand. Yes, what is the correct answer? Nuclear family. Very good, Karthik. Nuclear family is husband, wife and their dependent children, less than 18 years of age. है ना? After 18 years of age, the children become dependent. They become independent, I mean. They become independent and they can leave. है ना? They can have their own family. Okay, so correct answer is B. It's not husband, wife and only son. Why Shraddha? Why Surya? Why Vanlakshmi? It is not the thing in nuclear family, daughters are not there. Husband, wife and their children is better, na? Huh? If B was not option, I will go with A. But why you all people, Amu, you are saying A? Huh? Have you realized the correct answer is B, not A? It's not always son in the nuclear family. Daughters can also be there. So say husband, wife and children. With children who are dependent, less than 18 years of age. After 18 years, they will have their own family. The children, they will leave. And if they are living together after marriage with their parents, it's a joint. It's not a nuclear family. It will be a joint family. Got my point? There is a husband, there is a wife. Hana, they got a child. They got a child, maybe a son, maybe a daughter, maybe a son. Hana. So till the son is in 18 years of age, the son will remain with the parents and it's a nuclear family. After 18 years, just suppose the son get married and he is a husband and he also have a wife now. And now there are 2 options. Either they live separately. So these are 2 separate nuclear family. And if they are living together, it will be no more nuclear family. Now it will be a joint family. This is how we go. Okay. So correct answer here is B. Got it? The next question, Kuppuswamy scale of socioeconomic status of a family based on 3 criteria. What are the 3 criteria? Is it income, number of livestock, and number of acres zameen you have? Income of the family, number of members in the family and education, number of vehicles you have in your family, how many cars, how many scooters, occupation of the head of the family and education, or the income, occupation of the head of the family and education of the head of the family. So status do not depend on how many vehicles you have. Status do not depend how many members are there in the family. Status do not depend how many livestock are present in the family, how many acres zameen you have. Status depend on 3 things: income, occupation, education. Income of the family, occupation of the head of the family, and education. So it is basically the head of the family that decide the status of the family. The high class family, the middle class family, or low class family. That is depending on the head of the family. The head of the family, education and occupation. So can we go ahead? Next question, very easy. Socioeconomic status in urban areas is given by which scale? Kuppuswamy scale, Sullivan index, Human Developmental Index, HDI, or PQLI, Physical Quality of Life Index. Very easy question. Socioeconomic status. So correct answer is Kuppuswamy. We all know that. Hana? So correct answer is Kuppuswamy. Absolutely right. Hana, we are done. Coming on the last chapter. You want me to teach the history? Hardly any question comes from this. So very less important topic, but we will cover it quickly. So let's take the history, the last topic. Okay, so can I start the history? Are you people there? Okay, just a second. The last chapter number 1, I mean the history, primitive and modern medicine, I mean historical importance. So let's first complete the primitive medicine and then I will come on the modern medicine. One by one we will see. So let's come on the primitive medicine first. Primitive medicine. In the primitive medicine we have 5 systems of the medicine: Ayurveda, homeopath, yoga, siddha, Unani. Just take important word. Now don't go in detail. Anna, the Ayurveda doctors are different. I guess none of you is Ayurveda doctor. We all are, we are, I mean, you all are doing MBBS. So Ayurveda degree is different. Hannah, homeopath degree is different. These are different doctors. Just see the principle of this medicine. Don't try to go in detail. Okay. So coming on Ayurveda, who is the god of Ayurveda? Dhanvantri. Dhanvantri is the god. It's a PYQ. Dhanvantri is the god of Ayurveda. Hannah, Ayurveda. Veda means science. And Ayu means life. So it's a science of life. Ayurveda. Okay. Sasika, I have enumerated the scales. The socioeconomic status, you are asking for the rural people. Now, I have enumerated urban and rural both. I have to go back to show you that page. So please see in your notes. I have enumerated. So for the rural, I told you Udai Prasad. Udai Prasad is the name of the scale. And for the urban, I told you most common we used is Kuppuswamy. But you see the detail of Kuppuswamy, don't see the detail of Udai Prasad. But the name, if you want to know, the answer is Udai Prasad. Got it, Sasika? And you can know the names. Don't go in the detail. Question will be from Kuppuswamy only. Okay. So that is in your syllabus. Others are not in your syllabus. You just see the name. Can we go ahead? Okay. So Ayurveda is the science of life. The principle is that it depends on Trishod theory of disease. Hana, Vata, Pitta, Kapha. Have you heard about these words? Vata, Pitta, Kapha. Vat is wind. The Pitta is the gall, the bile, I mean, the bile, Hana, the yellow bile. And Kapha is the mucus. When we cough, the sputum comes now. So this believes that diseases occur due to imbalance between the three. Hana, it believes that. The Trishoda theory of the disease. Vata, Pitta, Kapha. Hana, so please learn that. That's it. Don't go in detail how it occurs. Vata, Pitta, Kapha. That is the principle of Ayurveda. How many of you got it? The principle of Ayurveda. Learn the god, Dhanvantri. Do you celebrate Dhanteras before Diwali? A day before Diwali. Whenever is the Diwali, a day before that, there is a festival Dhanteras. Dhanteras is the birthday of Dhanvantri. So on that day, he's the god of health. He's the god of Ayurveda. So we should worship health. We should worship this god. But I don't know people worship money on that day. They just do the worship of their almirah, their cupboards, and the money and the finances, the bank lockers. So the Dhanteras is a festival of health, to celebrate the health. It is not a festival to celebrate the money. So I know health is wealth, but don't take wealth. Take health first. Health is ahead of wealth. Anyways, let's go ahead. Okay. Homeopath. Who is the father of homeopathy? Dr. Samuel Hahnemann from Germany. It's a PYQ. Please learn. So he is the father of homeopathy. Have you seen homeopathic medicine? These are like small white color circular ball like. Multiple small balls like there. So these are sugar tablets, small. Just take it and don't take it with water. And just in the mouth you can keep it. Usko chooste hain baith ke. So on that the spray of the medicine is there. So all homeopath medicines are same. They are like sugar coated white color small balls. And the spray is there. Different medicines spray on different that. They all look alike. They all look like. They are sweet. Yes. So that is homeopath system. He is the father. So there are 3 principles here. The first principle, I don't know the language. I will try to read. Similia similibus coranter. I don't know. Just have a look. If it is coming in the option, definitely you will identify. For me, it's looking like something Simba. Okay, just forget it. Just have a look. This is a language. I don't know which language. So what does it mean? It means that use of small amount of drug in healthy person produces the same symptom as certain diseased person. So here in homeopath, the medicine, it will produce the same symptom in the healthy people, the same symptom in the diseased people. So never give homeopathic medicine in the healthy people. है ना? Just suppose there is a person who is having tachycardia. I will give a medicine to reduce the heart rate. So in tachycardia, if the heart rate is reduced, it will become normal. But if you are giving the same medicine in a person with normal heart rate, so the person will have bradycardia. So producing similar effect in diseased and non-diseased, that is the principle. Second principle, start with single medicine at a time. They don't give multiple medicine at a time, one medicine at a time. So that is the second principle. And third principle, minimum dose started. They start with minimum dose and then they gradually increase. So these are the three principles of homeopath. Just learn. The third is the yoga. Everyone knows yoga. It's Vedic science and art of healthy living. So the major text, Yoga Shustra, Yoga Sastra. It's a book written by Patanjali. We know in India, Patanjali is a brand name. You know who's the the man who's doing yoga in India. The Patanjali is the brand there. The Patanjali is the word taken from here. It's a book written by Patanjali. Patanjali is the main person who does yoga, who has introduced yoga in India and everywhere, I guess. The principle is disciplined life with positive attitude, can control the body without drugs. They feel don't give drugs for anything. Just live a disciplined life with a positive attitude that can treat the diseases. You will be healthy forever. Without drugs, the diseases can be treated. That is the principle behind yoga. I don't believe in all these. Frankly, it's personal. It's my opinion. It can be changed if you can convince. I don't believe in Ayurveda. I don't believe in homeopath. I don't believe in yoga. I believe in allopath. That is my study. I have done my MBBS MD in allopathy. I believe in that because I can understand everything there. Maybe the person who have done studies in yoga, studies in homeopath, studies in Ayurveda, they are convinced with these principles, but I don't get convinced. So that is the thing. Anyways, Sriniket, okay, good one. Okay, let's go ahead. So we are done. We are done with the three. The fourth one is the Siddha. Siddha means achievement. Okay, Siddha means achievement. The word Siddha means achievement. It's practiced in Tamil. Not everywhere in the India. In India, it's practiced in Tamil and abroad it is practiced. So what is the principle? Again, three things. Vadham, Pitta, Kabam. Vadham is air, Pitta is fire, and Kabam is earth and water. So again, the imbalance between the three can create the disease like that. So that is the principle. Unani भी Greece में practice होता है, not in India. It is based on humoral theory. The blood, the phalgum, the yellow bile, the black bile. So these all are theories. I don't believe in them. Just have a look. This is primitive medicine. What is modern medicine? Let's come on modern medicine. We are done with primitive, the 5. Learn the important points in that. Don't try to go in detail, ki ma'am, how the pitta, vata and all these, how they cause disease, explain. I'm not expert of that. I cannot explain. Just learn the principle. Go ahead. Modern medicine. Let's come on modern medicine. Combine everything. That is Ayush. Have you heard about Ayush? Have you heard about Ayush? What is the full form of Ayush? A stands for Ayurveda. Y stands for yoga and neuropathy. U stands for Unani. S for Siddha and H homeopath. I have combined all 5 together. So that is modern. Not individually. I have combined all 5 together. This is the symbol. This is the logo of Ayush. You can see it's like a flower. Can you see there is a flower? Whenever you see a logo, try to make it out kiske andar hai kya. Inside which 3 petals are there. You can see. And you can see something like the stalk. This is Ayush. This is the logo of Ayush. Please learn. Okay. So what is the full form of Ayush, please? Ayurveda, Yoga, Unani, Siddha, Homeopath. I have explained you all 5. The combination of the 5 is Ayush. It comes under ISM and H. Indigenous System of Medicine and Homeopathy. Indigenous System of Medicine and Homeopathy. That have launched the Ayush. Ayush was a main component of NRHM. Tomorrow I will teach you National Health Program. National Rural Health Mission. NRHM. Okay, so that is the thing. We are done. Tell me the answers. Tell me the answers fast. Fast, people. Somil Hahnemann is a father of what? Father of Ayurveda, father of allopathy, father of homeopathy, or father of yoga? What is the correct answer? Yes? So you all are right. The correct answer is homeopathy. He's the father of homeopathy. Okay. One more thing. We will see few important scientists in the history. So we will see 5 important scientists. The first one is the Hippocrates. Hippocrates, he is the Hippocrates. He is the father of medicine. He is the first true epidemiologist. And he is the first chest surgeon. First chest surgeon. He is father of medicine. First chest surgeon and a true epidemiologist. A great man, Hippocrates. He has written many books. most famous book of Hippocrates on earth, water, and places. One more book, Epidemic 1, Epidemic 2, multiple editions are there. Okay, what are the contribution? What he has done? He has rejected supernatural power or divine force as the causative of illness. Before Hippocrates, people believe that God gave diseases. Hana, don't use the word God, say supernatural powers. Hana. So these are some supernatural powers or divine forces that are giving illness to the people, and that is related to the karma. And the one who is having bad karma, they will have the illness. The one who is having good karma, they will be healthy, like that. So they don't believe the bacteria, virus, or fungus or parasite exist. Actually, the diseases are caused by microorganisms. So first time he rejected this theory. So he was a man with courage. He rejected that there is no divine, the divine force is not causing the disease. It is the microorganism which is causing the disease. Okay. He has introduced doctrine of 4 humors, like the blood, black bile, yellow bile, and phalgum. The diseases is due to imbalance between them. Hana, that is a thing. He described clubbing, Hippocrates faces hot and cold diseases. Hana, and he categorized what is epidemic, endemic, acute disease, chronic disease. And he described the rectum, and he has first time done the proctoscopy, the endoscopy of the rectum. So he has given many contribution in that era, the Hippocrates. That's why he's the father of medicine and first chest surgeon. Who's Sushruta? He's Sushruta. See what he's doing. He's performing a surgery, plastic surgery. He's the father of plastic surgery and cosmetic surgery. Hana. So he has introduced plastic surgery first time. Sushruta. He is the father of Indian surgery. Hana. And he has written a book known as Sushruta Samhita, the book written by him. Hana. He has given the principles of plastic surgery. He has introduced 300 type of surgeries. He has taught us 300 type of surgeries in that era when nothing was available. And 120 surgical instruments he discovered. The forceps, the knife, the scalpel, and multiple instruments. Hana. 8 type of basic surgical procedure he taught us. He taught us what is excision, how we give the incision, how we give the excision, how we do the suture, how we do the puncture, how we do the probing, how we do extraction, how we do drainage, and how we do saccharification. These all are surgical processes he taught us in that era. See, a great man, surgical man. He was having the surgical skills. So he's a great surgeon. Okay. Stages of the surgery, he taught us what is pre-op, op, post-op, what should be done, and classification of the bones and their injuries. So that is the contribution. The next is the Edward Jenner. See, he's the father of immunology. Learn who is the father of what. So he has first time discovered the vaccine, smallpox vaccine. He has coined the term vaccination. So that is the thing. John Snow, he is the father of epidemiology. The father of true epidemiology is Hippocrates, and father of epidemiology is John Snow. I told you the story of cholera, the spot map yesterday, London Bridge, spot map, England. In the England, he has seen the cases are clustered at one place. So there is a water source, common river supplying everyone. So he studied cholera, and he discovered that the causative agent is present in the water 50 years of before its discovery. He is the father of modern epidemiology, and he's a greatest doctor. It is known as greatest doctor. This proverb we use, this honor we give to John Snow. The last one is the Louis Pasteur. I guess he's the last one. Yes. The last one is the Louis Pasteur. He's the father of microbiology. Okay. Very important person. He has gave the germ theory of disease, that the diseases are caused by germs, the bacteria, the virus, the fungus, the parasite. He coined the term vaccine. Vaccine term given by Louis Pasteur, but vaccination term given by Edward Jenner. Yesterday also I taught you this, if you remember. He developed 3 vaccines, the vaccine for cholera, anthrax, rabies. He discovered vaccine for cholera, anthrax, and rabies. He introduced technique of sterilization in microbiology, techniques of pasteurization. He discovered hot air oven. He discovered autoclave. So he is a father of microbiology. Learn this table. Who is the father of medicine? Listen. Modern medicine, Indian medicine, god of medicine. Chalo, medicine khatam karo. Medicine. Who's the father of modern medicine? Hippocrates. Who's the father of Indian medicine? Charak. And who's the god of medicine? Dhanvantri. I told you. Dhanvantri is the god of medicine. Now come on, surgery. Okay. Modern surgery, Indian surgery. Who's the father of modern surgery? Ambroise Paré. And Indian surgery, Sushruta. I have shown you 300 surgeries he have discovered techniques. So Sushruta. Who is the father of epidemiology, modern epidemiology? It's John Snow. But true epidemiologist is Hippocrates. Who's the father of bacteriology? Louis Pasteur. Father of biology? Aristotle. Father of genetics? Mendel. We all studied Mendelian law. So learn all these. Who's the father of homeopathy? Samuel Hahnemann. I already taught you. Please learn the fathers. All fathers at one place. You get questions from them. Please learn the important discoveries. First vaccine is discovered by. The term vaccination is given by. The term vaccine is given by. Vaccination coined by Edward Jenner. Vaccine given by Louis Pasteur. The 3 vaccines. CAR is discovered by Louis Pasteur. है ना? Penicillin, the first antibiotic discovered by Alexander Fleming. You may be knowing that. Growth chart, yesterday I taught you, discovered by David Morley. है ना? Growth chart, है ना? The road to health. I told you yesterday. So I want you to learn it. है ना? I want you. It's simply rectification. You people are awake or sleeping. You have to learn it. Okay. You can learn. Not very important. You can skip also. But these are the author of the book. है ना? Important book. Usually question is on air, water, places. This book is written by Hippocrates. है ना? Ayurved text of Nidan written by Madhav. Charak Samhita written by Charak. है ना? Sushruta Samhita written by Sushruta. Like that. Learn the books. The book of healing. It is written by Avicenna. है ना? The antiseptic principle and practice of surgery written by Joseph Lister. So these are the name of the book and their scientists. है ना? The first country honor. The first country to socialize medicine completely, it's Russia. The medicine will be free for all. The first country to introduce compulsory insurance is Germany. In Germany, compulsory insurance is there. For everyone, there is a health insurance. The first country to start the family planning, it's India. It's necessity. The first country to start blindness program is India. And the first country in which first time fingerprint bureau is there, it's again India. It's in Calcutta, the fingerprint bureau. So learn that. है ना? Lastly, these are the important diseases you have to learn and their name. The father of the public health is cholera. It's all the fathers were some person. है ना? Father of epidemiology, father of medicine, father of surgery. But the father of public health is a disease. It's cholera. है ना? And learn the other name of the diseases. I'm not reading it. We are done. Okay, read the question, tell me the answer. Fast, people, fast. Read the question, tell me the answer. Which of the following is known as father of public health? Just now I taught you. Is it TB, cholera, John Snow, or Louis Pasteur? It's not a person. It's a disease. Cholera. The correct answer is cholera. Okay, cholera. So cholera is a disease that is considered as father of public health. Okay, smallpox vaccination was discovered by Paul Ehrlich, Robert Koch, Louis Pasteur, Edward Jenner. Smallpox vaccine. Yes. So what is the correct answer? Edward Jenner. Edward Jenner. Okay, so correct answer is Edward Jenner have discovered the vaccine. That's why he is the father of immunology. Okay, and he coined the term vaccination, not vaccine. The term vaccine is coined by Louis Pasteur. You know that. That's all about it. Thank you so much. We have covered 7 chapters. 7 plus 1 in the morning. That is demography. So we have covered 8 chapters today. Hannah, yesterday we have covered 2 chapters. A day before yesterday also we have covered 2 big chapters. 2 or 3. The first day we have covered 3. Screening also we have covered. So till now we have covered these many chapters. Still, what is left now? Let me enumerate the left one. So we are left with communicable disease, which is a big one. Biostats is moderate, and other numericals are there mainly. But numericals usually don't come in your exam. FMG if you are targeting. So biostats, non-communicable is very small. We can take it now only. It is hardly 15-20 minutes. I want to teach you 2-3 diseases. Blindness, obesity, MI, smoking. These are the important points here. And National Health Program, the big one. And yes, this health communication, education, and health services. So big one is only one, the communicable. Rest all are small. They are moderate. So these 5 are pending. Anyone, anything to say? So we will start from tomorrow only. Tomorrow morning. Can we start early in the morning tomorrow so we can finish it on time? Otherwise, I have to extend the class tomorrow till 7 or 8. So can we start early? Can you people come early? I will ask the team to arrange a class early at 8 a.m. in the morning or 8:30 a.m. Say people, I'm asking you, respond. I'm asking to start early. Tomorrow is my last day for PSM. If something is left, it will be lost for you, not for me. So one day you can cooperate. I guess you can get up early. Anyways, we are going to start at 9. Anyways, if you allow, I can start at 8. So we will finish it on time till 5 or 6 in the evening. Otherwise, we start at 9 only. It will be extended in the evening. Can we start? Everyone? So many people are saying fine. Early morning is fine. Aditi, Shriniket. Anyone having any trouble? 8:30. Okay, beach ka rasta. Not 8, not 9. आधे घंटे में क्या फर्क पड़ेगा? Okay. So most of the people are comfortable at 8:30. Can we start at 8:30 then? Okay, let's fix then 8:30. Okay. Everyone comfortable at 8:30? Can we start at 8:30? I will start with 8:30. I will decide the sequence. Maybe I will start with the communicable disease. The biggest one we will finish in the morning only. After that, small chapters are there. We will finish them one by one. If anything I am forgetting, you can help me for reminding. I guess I am completing everything. I will cross-check the list today. If anything is pending, I will cover that also tomorrow. I don't think apart from these 5, anything else is pending. The major chunk, small chapters we have completed today only. That's why we have completed. And the big chunk is already over. Epidemiology is over, demography is over, preventive obstetrics, pediatrics is over, screening of the disease, chapter 1 is over. And on first day, what else we have taken? Health and disease ke apart, screening of disease ke apart. One more chapter we have taken. Okay. Anyways, so we will start tomorrow morning at 8:30. Everyone is comfortable? Okay. Everyone is comfortable, I guess. Anyone having trouble in this, kindly write that person only. Anyone having any trouble in 8:30? Yes, the nutrition one. Yes. So the big chapters are already done, I guess. The scoring one. Yes. So thank you so much. See you tomorrow morning. The last day you have to be here and cooperate with me. Thank you for your patience and giving so much of time to me. Thank you so much. Thank you so much. I'm really obliged. Thank you so much. See you tomorrow. Tomorrow morning, 8:30 a.m. The last day. The last day. Okay, 8:30 a.m. sharp. We will try to pack till 5 or extend it till 6. Hana? Because after 6 in the evening, I'm having some other commitment. So I cannot extend the class after 6. I can extend in early morning, as early as you say, but I cannot extend in the evening hours because already some other commitment is planned. Hana? So I cannot extend. So thank you so much. Bye-bye. Have a nice day and study hard. All the best. See you tomorrow. Be on time. 8:30 means 8:13. Fix your alarms and be on time. Bye-bye.